Check, check, check. 1, 2, 2, 2, 2. Check, check, check. 1, 2, 2. Two, 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 two. Check, check, check. Okay.
Oh, maybe it's the box. Okay.
Check, check. 1, 2, 2, 2, 3, 3, 2. Way better? Yeah? Okay.
Members of the Licensing and Standards Committee, please report to Committee Room 1 for quorum. Thank you.
Okay, we have quorum. We're going to resume the meeting. And I'm going to ask the Executive Director of Municipal Licensing to make a presentation on this item. And we are dealing with the item before us is LS 21.2, City of Toronto recommendations for cannabis legalization.
To deal with this item. Thank you very much. We were able to pull together a quick presentation to walk you through the summary of the recommendations that are in the report that are before you today, dealing with City of Toronto recommendations in respect to cannabis legalization. So just by way of background, for those who may not be aware, the consumption of cannabis or marijuana for medicinal purposes has actually been permitted federally since 2001. There have been two different rewrites to that legislation governing exemptions to the CDSA for medicinal purposes. The enforce and effect legislation right now is the Access to Cannabis for Medical Purposes regulation, which was enacted in 2016. So I provide that simply for clarity that the matter that we're discussing today is not about the medicinal use or the medicinal regulations. It is about the pending federal legalization of cannabis for non-medicinal use. The proposed rules the federal government have provided would take care of the production side and then default the issue around distribution to the province. As it turns out, on September the 8th, the province of Ontario released their intentions in respect to the proposed distribution model, as well as some other elements that fall under provincial purview. So this report is to provide you a summary of recommendations that we would like to have made, or at least staff have compiled for committee and council's decision to advance to both the federal and provincial levels of government in respect to the pending legalization of non-medicinal recreational cannabis use. So the federal regulation is Bill C-45, the Cannabis Act, and that is what has started us on this journey towards legalization. It outlines a variety of considerations, a summary of which are provided on the slide here, generally about the minimum age of purchase being 18 or older, and then defaulting to the provinces if they choose to set a higher number. Speaks to the quantity of dried cannabis that can be in a person's possession, up at maximum of 30 grams. It outlines additional regulation on how it will be produced under licensed producers, speaks about packaging and labeling and a variety of other conditions. A couple of these do have municipal interests, which I'll speak to briefly as we go through this. And just for additional clarity, the Bill C-45 Federal Cannabis Act does not address the issue of edibles, cannabis in edible form for production or distribution at this time, though they have noted that is an outstanding body of work as we go through. So on September the 8th, the provincial government announced its framework related to the province's role in the legalization of cannabis for non-medicinal use. And what they had released is their intention to establish a provincially operated retail model with stores operated by a subsidiary of the LCBO. They have indicated, as far as places of consumption, that consumption be restricted to private residents only, that a minimum age of purchase be 19 years of age, that the province and as well as the federal government throughout has really maintained a public health and especially impact on our youth lens as they're addressing legalization. As well, talking about an enforcement strategy to deal with those who may choose to operate outside of the lawful regime that is yet to be put into place. The province has indicated a goal of having 80 storefronts operated by the province in place in time for the July 1st, 2018 deadline, and 80 by July 2019 and 150 by 2020. So the province has identified a staged rollout of provincially operated storefronts, and there will be more to come on that. So just to give you a sense, as city staff, we've been speaking about this issue since the federal government released its intentions. The interdivisional working group is comprised of Toronto Public Health, City Planning, Toronto Fire Services, Toronto Building, the Toronto Police Service, our City Manager's Office, and others. We do have representatives from Toronto Fire and Toronto Public Health and City Planning here today as well. Throughout this process, I can advise that City of Toronto staff have been involved both with the initial federal task force roundtables and have had ongoing dialogue in trying to understand what the municipal interests, issues, or concerns may be, given that up until September the 8th, we were operating in a bit of a vacuum as far as what that model would, what the distribution model anyway would look like and what the impacts might be for Toronto. So with that in mind, the report you have in front of you outlines a series of recommendations primarily geared at our asks, our requests, our needs to the province and in some cases the federal government. And it starts with our endorsement of the province's plan for provincially operated retail model. This was previously discussed at the Board of Health through the Toronto Public Health Report in June of 2017. We believe that the legalization for non-medicinal use of cannabis is an important thing that needs to be done very deliberately and very cautiously, bearing in mind the public policy objectives surrounding this really tie to our interest in ensuring public health, our youth's health, and dealing with the outcomes of the illicit market. So with that in mind, we have suggested that we endorse the province's plan for distribution. We've got another series of recommendations that outline the potential impacts or those matters that we are currently dealing with and have been dealing with since last year with the proliferation of illegal storefronts operating in our city. So we're outlining that we feel in a go-forward model, we still are going to require partnerships, most certainly at the provincial level and with police, to deal with enforcement in that regard. We are asking that the city be involved in the discussion around where the provincial storefronts will be located. We believe that this type of an operational partnership will be important to ensure that the community interests are heard. We're also suggesting that the province and/or the federal government, as is appropriate, assist the city in recovering the costs that we have had and may have in the future in respect to enforcement around the legalized regime, but around the illegal regime that has evolved. Of course, we are reiterating as well, just in one point, Rec 9, the importance that the province earmark funding and really put a strong emphasis behind public education, but also the ongoing research that needs to happen so we can understand what the impacts are to our citizens. In respect to enforcement, it's, I think, reflected in Recommendation 5. We are outlining a number of additional authorities we believe the city would benefit from having in the context of the future legalized or regulated regime and what we want to ensure that we have to address any of those who choose to operate outside of that. So regardless of whether or not illegal storefronts continue to operate, we feel there are a series of tools that would benefit the city in respect to enforcement against those who choose to do so. These include our ability to attract higher maximum penalties or fines for anybody who's selling, operating outside of the regulated regime, looking to authorities to more quickly close the premises where these illegal storefronts are operating, etc. So really the purpose of this report was intended to give you an update on where things were pending the surprise announcement the province gave on September 8. As far as timing goes, we reframed the report simply feeling that it was still important to give you an update on where things were, give you a sense of what we as city staff have been undertaking over the last more than a year in these discussions, outlining what we would like to see as recommendations to the province and/or the federal government to ensure the City of Toronto is fully and adequately equipped to address the legalization of cannabis for non-medicinal use, but also the tools necessary to enforce against those who continue to operate illegally. We are continuing our discussions with the province in respect to some of these key items and hoping as they move forward with their regulatory framework, the The legislation that is drafted is considering these particular issues as it relates to municipal impacts. So that is the intention of the report today, and I guess after deputations, we'll be happy to discuss further.
Thank you so much for your presentation. Members of the committee, in terms of questions, we'll do the same thing. We will do the deputations first. Later, yeah. So before we start now, first I want to thank all the members of the public for your patience and for waiting. And one thing that probably is going to be very helpful is that as you speak, if you focus on your remarks as it relates to the report's recommendations and avoid duplication, that will help tremendously, and we can move forward as fast as possible. And with that, we'll get to the first speaker, Kevin Hall, followed by Abby Hall and Lisa Kimball. Kevin Hall. You have 5 minutes, and to facilitate the timing, you have a clock there as well. Please go ahead, 5 minutes.
On behalf of the community and stakeholders today, my name is Kevin Hall. I'm Executive Director of Chronic Pain Toronto. It's a federally licensed nonprofit based out of Toronto, Canada. I'm also the CEO of a company called International Cannabis Solutions. There's too much to possibly cover, as I've prepared a document along with a previously submitted document, December 15, 2015, to the City of Toronto, titled The Pain Epidemic in Canada and Where Cannabis Fits into Our Overall Treatment Plan. All members of this committee, city councillors, received this by email between December 15, 2015 and June 2016, including all their staff, Mayor Tory, and TPS. International Cannabis Solutions is also based out of Toronto. It's got a global reach with an expert team with over 150 years cumulative experience in healthcare, education, pain management, addiction medicine, pharmacology, and more specifically, cannabis and cannabinoids. We are uniquely positioned to address the federal government's task force recommendations and needs analysis findings to provide evidence-based knowledge and consultancy for all level governments within Canada and globally. Chronic Pain Toronto's mission is to help chronic pain sufferers, subsequently their families, reduce and prevent harm, pain, and suffering. This is accomplished through sharing evidence-based resources, community resources, and vetted information relevant to chronic pain and access to treatment with need to spreading awareness and education, which includes preventative measures. That report I mentioned earlier discussed the pain epidemic in Canada, treatment of chronic pain, the definition of medical cannabis, and international learnings about legalization, both medical and adult use. Case law in Canada and internationally were also included in that document. Well, I encourage you to review the report in detail. I'm here today to discuss the City of Toronto presenting factual data, research, and evidence. I also want to encourage further public consultation on this process so we have an evidence-based knowledge and policy change which is consistent with the Toronto Drug Strategy's position. And I quote, "The City of Toronto's Drug Strategy Report 2016 indicates leadership and coordination are critical to improving our collective response to alcohol and other drug issues. Through the TDS, the City of Toronto has taken on this leadership role, recognizing that success depends on effective collaboration and cooperation amongst all stakeholders." I have to ask, has this mission been effectively been maintained with very little collaboration among stakeholders in this matter? Our honorable executive director, I'm sorry, I forget your name, she mentioned that there was a lot of internal consulting going on through the province and the city. I didn't hear anything about stakeholders, whether it be the public or actual professional organizations outside the city or government being consulted in any manner. In fact, I'd like to hopefully get some answers to that at a later time. We were encouraged to see Toronto's chief medical officer made her own comment to CBC June 2nd, stating that a significant number of young Canadians will continue to obtain criminal charges before cannabis is legalized Dr. Eliane de Villa warns that in her report, which was reviewed by the Toronto Board of Health, she states, given that cannabis possession will soon be made lawful in Canada, it recommends that the Board of Health urge the federal government to immediately decriminalize the possession of non-medical cannabis for personal use. Effectively, she is discouraging future criminalization and arrest for prosecution due to public harm of criminalization. This is especially true in the light of, we also have another comment from a former police chief of both Sudbury and Victoria. His name is Frank Elsner. He provides this comment. The cost of investigating, prosecuting cannabis dispensaries is a huge cost and burden of precious police resources as well as the judicial system. This is especially true in light of public sentiment, recent court rulings, and new federal legislation. A fair regulatory system needs to be implemented that doesn't add to the already overstressed system. Again, former police chief Sudbury, recently Victoria, and part of Umbra Strategic Solutions. I support the government's two biggest concerns with this new legislation surrounding cannabis, which are protecting our youth and eliminating the black market. In this regard, we want to further encourage an evidence-based approach to policy change and recommend looking at the models of Portugal and Colorado, which are both privatized and implemented their lessons learned for success in public health harm reduction principles. Both models emphasize education over law enforcement as a key tool for success in both areas. Education is socially integrated programs and non-aggressive approaches to law enforcement are shown to be the formula for success and integration. It has been proven that the current law enforcement approaches are costly and result in a diversion of key resources from priority policing initiatives.
Thank you. Any questions from the deputant? Vice Chair Karijanis, please go ahead.
Thank you, Chair. Through you to staff. You're involved in the industry for a long time, and I was wondering if you can sort of elaborate any consultation that was undertaken provincially and or federally with where we are today.
Any consultation
that was taken by the provincial or the federal government in view of where we are at today?
Well, I can tell you that the report that we did submit to the City of Toronto on December 15th was used amongst many steering committees across the country, the Senate, the Federal Task Force, many municipalities across the country, and frankly, we're confused why Toronto didn't want to look at it or resource it.
The decision that was made by the province, was the industry involved in the consultations? Was there submissions made?
No, in fact, they also we're also asking them to see who the stakeholders they were. They did consult. So as an independent and as a nonprofit, we can actually add added value. But without that transparency, we find it very hard to be helpful in this matter.
So we're probably the only folks that sort of asking you to make comments on the report that was written, but the only consultation that's actually taking place.
It's been internally.
All right, thank you.
Other than the Executive Health Committee comments that were last week.
Thank you.
Any other questions? Thank you for your presentation.
Thank you.
Abihal. The next deputant, Abihal, followed by Lisa Kimball.
That's good? Okay.
Please go ahead.
All right. Good afternoon. My name is Abby Roach. Abby Hott is my real name, owner of the Hot Box and director of the CFBA. To put this simply from the top, the private dwelling consumption scheme the province of Ontario is planning to roll out is simply not feasible for the City of Toronto. In a city of 475,000 rental units, where condo and shared dwelling households represent 50% of the housing market and rapidly growing, 90% of which are non-smoking, whereas in your home, cannabis consumption is supposed to occur. The City of Toronto is currently home to over 700,000 regular cannabis consumers, and this number is only due to grow with legalization. Are parents expected to smoke marijuana in their homes with the children in the next room, people living with the elderly, or those with respiratory issues? Are landlords expected to allow cannabis smoke in apartments that have no cigarette smoking rules? And will this take into consideration neighbors, roommates, and others living in close proximity to units occupied by cannabis consumers? We then have to consider the vast tourism market of over 1.5 million tourists who visit our city each year. Many more will come simply to enjoy what they would come to expect of legal cannabis. Where are these tourists supposed to consume their legal cannabis? In their non-smoking hotel rooms? People who live in urban centers simply do not have the luxury of private outdoor space. Our parks and streets will become the consumption spaces if cannabis lounges are forced to lock their doors, not due to lack of respect for the rule of law, but simply out of necessity. The City of Toronto already has a solution for consumption in existence. We are home to 7 cannabis lounges, which each serve an average of 10,000 cannabis adult 19+ consumers per month. And yes, every lounge asks for ID at the door. These lounges are spread over the city landscape from east to west and are an integral part of the new legal landscape. Cannabis lounges have existed in the City of Toronto since the opening of the Hot Box in 2003. When Canada's cannabis laws fell the first time, when on Friday, May 16th, the Ontario Superior Court upheld the lower court decision concerning a case of pot possession in Ontario. This decision was binding on Ontario's lower courts, which means that no one can be convicted of pot possession in the province of Ontario. Since 2003, Toronto has not seen a lounge explosion. Currently, none of the lounges dispense cannabis, and all operate on a bring-your-own cannabis basis. The lounges do offer the free use of vaporizers, a far superior and safer consumption method to smoking. They also provide education, as well as offering a social setting, which is amazingly beneficial to our medical consumers, many of which are seniors, veterans, the disabled, and those suffering from debilitating chronic pain and ailments. In 2012, MLS conducted its own investigation into cannabis lounges. The issue of licensing cannabis lounges had been brought to the city, at which time a report was prepared and presented to the Licensing and Standards Committee. I had them printed. They're on your desks. You can take a look. It was determined that cannabis lounges provide a safe space for patients to medicate and cannabis consumers to congregate. Quoted, allowing these establishments to be properly licensed will ensure that the city respects the rights of individuals who are legally permitted to consume marijuana for medical purposes, while ensuring that public safety and community order concerns are addressed. MLS 2012. Furthermore, in that same report, the Toronto Police Services stated, though medical marijuana users are entitled to possess and consume their marijuana at home or at vapor lounges, the TPS believes there should be restrictions on smoking marijuana, including for medical purposes, in outdoor public spaces. So in conclusion, Toronto Municipal Licensing, Toronto Police Services, the Federal Task Force for Bill C-45, and the general public have all stated the need, want, and necessity of cannabis lounges to exist. I implore the City of Toronto to speak up and stand up for what is right for the citizens and the city. Our cannabis lounges are the solution to the future of public health and safety municipal policy when it comes to the issue of cannabis consumption in our thriving urban center. Thank you. If you have any questions.
Thank you. Questions? I know that this is an item that's extremely emotional to a lot of people, very important to you, but we have our own rules in terms of, and I'm going to refer to Chapter 27, Section 27-23, that it doesn't allow any display of signs, placards, applauding, and during presentations or engage in conversations on any other behavior that may disrupt the meeting. So I'm going to ask you, please, yes,
No clapping.
thank you so much. We have questions. Vice Chair Perjanes, please go ahead. Please go ahead.
Thank you. Through you. So these cannabis lounges, it's strictly using vaporizers?
We have my personal lounge that's been in existence for 15 years now. We allow for vaporization indoors, and we are blessed with a backyard patio, so combustion is outside, and cigarette smoking has to happen on the street.
So you would expect the same rules to apply with cannabis smoking and cigarette smoking?
I suppose, but the backyard patio makes more sense since
Oh, no, I'm not.
there
I'm not
isn't.
but that would be your expectation, is what I'm saying. You're not expecting.
It's what we have at our personal lounge. Other lounges I know have air filtration systems that do allow for smoke.
Okay, so I understand your lounge, but I'm just trying to understand, what would your expectation be? You made a presentation, so I'm trying to understand
absolutely.
what
I
your
understand.
expectation is.
I expect to meet halfway, and I think vaporization is one thing that is a great solution for the consumption problem. To be able to vaporize indoors would be fantastic.
But you don't expect smoking indoors?
I can't say that I expect anything, yeah. It would be great, but realistically, vaporization is probably going to be what would be allowed.
Okay.
Since it's not technically smoke.
Okay, thank you, that helps. And then you made up, I think you estimated the number of cannabis users. How many was that?
Over 700,000. My estimation is the statistics right now, about 25% of Canadians are regular cannabis consumers. So I divided the City of Toronto population by 25%.
And what do you expect it to grow to?
Right now, at the
With
last
legalization, right? You
Yeah,
mentioned it
the
should
last
grow.
report that came out, the polling went up to as high as 39%.
Okay, so about 40%, okay. And then, sorry, I'm not familiar with the cannabis lounges. What's the business model? Like, how do you actually make money?
Well,
Because I think you said you provide the vaporizers.
Yeah, we do
Free.
the free of use. Yeah, it's $5 entry at the door. For most lounges, it's all the same price across the board. That covers our, our staffing, and it covers, the building, whatever else not. And we also have a retail component that retails cannabis lifestyle products, so that's separate. For me, like, people always ask, it's like, well, what would you do if you had to close down the lounge? And it's like, I'll be fine. I'm a business person. I'll figure it out. But the 10,000 people a month that will have nowhere to consume, a lot of them are parents, a lot of them are seniors. Where are they going to go?
I was just trying to understand the business model more than
Yeah,
anything.
that's a business model, essentially. It's $5. Everyone has to be over the age of 19. There's no trafficking. We don't traffic. And
Well, $5
there's
a head to get in, and
Yeah,
and
we
then
sell pops and juice and snacks and whatever else not.
Thank you.
There's no other drugs allowed, and there's no alcohol allowed on premises either.
Thanks, appreciate it.
No problems. Yes, Chair.
Thank you. And Councilor Perjanes.
Thank you, Chair. Thank you very much for coming. Abby, is it the first
Yeah.
name? Abby, was your organization or anybody else you know in the industry being consulted by the province or the federal government about what was going to happen to your lounges, or the way that the dispensing of marijuana is going to be taking place?
No, everything that we have put forward, we have sent out. So we've sent out our reports and everything else to the federal task force report, which it was included. That was our recommendation, was their recommendation. Nobody called us. I did, prior to the election, at my BIA meeting, got to meet my MP, and she said something different was going to happen.
Let me ask this question. The fact that we're going to have dispensing by the provincial government on the 40 stores, similar to the LCBO model, you were not consulted on this?
Absolutely not.
There was no roundtables with the provincial government on this?
Absolutely not. They don't care, yeah.
Do you feel that this was an industry that was not consulted at all, or was thrown under the bus? Who cares about the folks?
I think the consumers were thrown under the bus, and the consumers weren't consulted. And that is the main problem, is that the consumer is who's going to lose out in the end, and the City of Toronto.
If we don't allow the lounges, and we say we're going to close the lounges down, as I know some of my colleagues sitting around this table certainly are advocating for, and people need to have, if you want to call it, the need to smoke as they're suffering. And if they got children at home or anything else that they don't want to smoke there, where would they go?
I guess they're going to have to break the law and go out on the street, because the proposed law sort of mixes alcohol. So you're not allowed to consume alcohol on the street, right? And then it mixes in tobacco, but it doesn't allow for consumption on the street or in public spaces, right? You're allowed to smoke your cigarettes out on the street. You're allowed to smoke a cigarette so far from this, that, and the other. You're not allowed to bring your alcohol out. So what they've done is they've essentially demonized cannabis. So now you can't smoke in a lounge. You can't consume on the street.
Somebody that was suffering from PTSD,
Yeah.
a first responder, vet, having to consume this in order to feel better. Do you think that putting this person out on the street add to his or her PTSD situation?
Absolutely.
So it would be irresponsible of us to put extra pressure on a first responder suffering from PTSD that was out there for looking to after us, or a veteran.
Absolutely. Absolutely. Or a parent, or just somebody who can't consume in their apartment in general. We're talking adult use.
Are you aware, this is a very important subject, Mr. Chair. Are you aware of any of PTSD sufferers that either were military, veterans, that are using this and feeling better? I mean,
Absolutely. I have a good part of my clientele are veterans and seniors.
So if we were to force them out on the street, could their reaction be more heavier? I remember in 2012, 2013, there was something like around Christmas time, there was about close to 7 or 8 vets that committed suicide.
Yeah.
Could this occur if we were to not support the...
I'm not a psychiatrist, but I do suffer from anxiety, and I know that for me to have a lounge to go to helps, definitely. So that's my personal situation, is being in a comfortable setting to take my medicine does help.
So we will be respecting our veterans. And
Absolutely.
Thank you. Appreciate that.
And our seniors and disabled. Yeah.
Thank you.
Any other questions? Thank you.
All right.
For your presentation.
Thank you.
Lisa Kimball.
Hi, good afternoon.
Good afternoon.
So this represents an enormous opportunity moving forward for the city to create dialogue with cannabis businesses as we near legalization. The fact that the Ontario government has decided that they would like to take our jobs and distribute cannabis is actually a sign of normalization. And you know, we're starting from a restricted framework, but there's lots of room to create diverse licensing. So to start, I'd like to speak to recommendation 1, which is that the city would like to go along with the province's plan. We know that what the provincial government announced last week of provincial storefronts will not work for several reasons, many of which will be addressed by other deputants. There's simply not enough storefronts announced. So there needs to be opportunities to license diverse businesses. So we just heard about the potential for licensing lounges and consumption spaces in the city. And as we know, the city will have to work with the province to amend provincial legislation. That includes the Liquor Licensing Act, as well as the Smoke-Free Ontario Act, to allow these businesses to exist. So if we're not going to have private storefronts dispensaries, if the city has decided with the province and the federal government to shut us all down, in order to eliminate the black market, you need to provide opportunities to integrate the existing gray market with licensing so we can be compliant. We want to be compliant with the city. We want to be working with government to provide safe access to our customers. But without having conversations, without engaging stakeholders meaningfully in dialogue, that's impossible. So our recommendation is along with recommendation 6, which is we know that the provincial government has recommended that the AGCO look at licensing consumption spaces. Because as we know in Colorado, once they legalized cannabis, they did not account for consumption spaces, and they had to go back and spend lots of money amending that legislation to account for these. So this is an opportunity for us to, instead of being regressive and taking a 1920s approach to legalization, we can be progressive as City Council and come up with innovative solutions for legalization. So what does that look like? Well, we've discussed the potential of lounges, we have safe consumption sites. There's a pop-up safe consumption site currently in Moss Park. What we would like, instead of pop-ups, is to have a real licensing prospects where stakeholders are consulted. That could take many different forms. It could take the form of lounges. In the future, edibles will be regulated as well. So restaurants, the hospitality industry in Toronto is going to want to have a huge stake in this. We have some of the best food in the world, and a lot of these chefs are cannabis consumers and want to participate in this industry. So instead of creating room for a black market by having no licensing available for these businesses, we need to work in conjunction with the AGCO to create these opportunities for licensing. Finally, Toronto is an international city, so we have to look towards international innovative models for cannabis legalization. So we know that we're not the first country to legalize cannabis. Uruguay has just legalized cannabis. No one's talked about it. No one from Uruguay was at the hearings last week on the federal level. They did not consult one single government official. So what did Uruguay do with legalization? At first, they endorsed pharmacies, just like the City of Toronto. The City of Toronto Board of Health recommendation was that we should have a pharmacy model as a solution to the dispensary crisis. What we've seen in Uruguay is that pharmacies were unable, just like in Canada, to distribute cannabis. So instead of taking a pharmacy approach to legalization, Uruguay has just opened dispensaries last week. They were not consulted at all at the federal level in terms of how we should roll out legalization. So because the pharmacy model failed, they have gone forward with dispensaries which are actually cash only because they're not able to access banking. Luckily in Canada, we have an enormous opportunity to work with government, to work with licensed producers, to have regulated access to cannabis through a diversity of licensing. If our Municipal Licensing and Standards Committee would actually engage us as stakeholders, along with Toronto Public Health, to figure out what is access going to look like? Because 150 storefronts is not going to cut it. Right now in Toronto, there's probably over 100. So to say that 150 access points will be, enough for the whole province of Ontario is, not very realistic. So we're hoping that given Uruguay's experience with pharmacies being a failing model, and given that the federal government has not licensed pharmacies for distribution, that we can look at alternatives to dispensaries, including lounges, bakeries, cafes, hotels. The potential for licensing and revenue for the city is enormous. We just need to have the conversation. Thank you.
Thank you. Questions?
Through you, Mr. Chair, are you aware that the city doesn't make profits off of licensing very many things? So when you say submit to us or suggest to us,
yes, I'm
legalize this
aware,
and you'll be rolling in money, we won't be getting any of that money.
Actually, there's a loophole in CODA that says that you can actually have a sin tax. So that was presented by KPMG to the Executive Committee, and it would be fairly easy for the City of Toronto to use that loophole to tax and license cannabis businesses.
Well, that regulation allows us to tax cigarettes and alcohol. So you're suggesting...
Yeah, not me personally, KPMG.
I don't think cannabis was in the legislation.
Pardon?
I don't think cannabis was in that legislation. But your suggestion to us is instead of the city could, theoretically, put a tax on cannabis and generate revenues from it.
Cannabis, but also cannabis businesses. So maybe licensing, the majority of funds would go to the province. But I think we can work towards the province to ask for that money to go to city services, including the Toronto Drug Strategy, which currently receives no funding for programs.
Okay. We've been trying to do that for 15 years on so many things. Maybe we'll get lucky this time. Thank you.
Thank you, Deputy Mayor. Anyone else? Councillor Burnside, please go ahead.
Thank you. Through you. So I read the parts of the provincial proposals, if you will, and they said, I think, to your point, 150 stores by 2020, storefronts. I didn't see anything that said they weren't willing to open more if the demand was there. Did you?
It seems that the Attorney General is open to a lot of future possibilities, including the potential for private storefronts. This is just the beginning. So hopefully, while there is the plan to close down every single dispensary in Ontario over the next year, we can still engage as stakeholders and push for dispensaries to be included as the model.
Right, but what I'm saying is whatever the province decides, they're going to make that decision, but they're not, I didn't see anything in stone that said it's only going to be 150 stores. It's 150 by 2020, but it could expand to 500, I guess, theoretically, could it not?
It could theoretically expand, but consumers are choosing with their feet where they would like access, and the products that will be carried in the government stores will potentially only include dried bud and oil. So if your goal is to eliminate the black market, the products that are available in dispensaries currently well exceed that. There are hundreds of different products. So I think that while I applaud the government for wanting to control cannabis, they need to integrate the existing businesses, or else consumers will just not show up to these stores. They might potentially boycott them.
Okay, thanks.
Any other questions? If not, thank you for your presentation. Clinton Young.
So we're from.
Oh, both of you are planning to make a presentation.
Yes.
Okay, that's fine. So you have each minutes, each one, and combined you have 10 minutes.
Thank you very much.
Thank you very much. My name is Clinton Young, and I am the CEO of MMJ Canada. I wanted to speak today regarding the regulations that do not include dispensaries of the private model. Since I took over being the CEO of MMJ Canada, we have a chain of dispensaries that have been working hard with regulators across the country. And we know that we sell cannabis, but I want to explain other things that we do outside of dispensing cannabis and kind of take this from a more positive spin, because these things aren't talked about very much. When I took over, it was a mandate that we gave back, like I said, more than just cannabis, and I wanted to give back to mental health because I suffer with PTSD. So we created the Lost Organization. The Lost Organization is a 16-week program that gives back to people with mental health illnesses through yoga classes, different structured programs regarding, it could be PTSD 1 week, it could be eating disorder, it could be suicide, it could be sexual abuse. We tackle all the aspects to give back to the community. We also created a fundraising division called the Collective Care. This enabled us to work with other community members and other dispensaries to raise money for different people who were sick in different charities. In the last year alone, MMJ Canada, with the help of multiple other dispensaries, have raised over $140,000. Now, I know that we get painted as criminals sometimes, and I think it's just a lack of education. But we have a patient that we help named Isaiah, and he has Angelman syndrome epilepsy. And he was getting his medication from Metrum, and he was paying about $600 a month, and his mother, Lindsay, went to CH News to speak about how she couldn't afford to keep her son. And, I don't know if you guys know much about Angelman's epilepsy, but he has about 50 to 80 seizures a day sometimes. When we got wind of it at MMJ Canada, we decided to take on the bill of Lindsay's medication expenses because the licensed producer refused to help. We then decided to keep taking on the bill until we could find a producer that could work with us and mimic the exact same medication down to the ingredient. The problem is with this that a lot of people don't hear about the things that we do in the community, and the dispensaries are doing all sorts of these things, and it's just not being recognized. I hope this council can open up their hearts and minds to see that there is a craft market that is needed. We all know that you want to eliminate organized crime. And allowing dispensaries with strict regulations but fair, I think would eliminate most of the criminal activity in the industry, because people who have to go through the regulations that you guys will set for dispensaries will just not want to go through it. They're not going to want to jump through the hoops. And that's why the task force recommended an inclusion for a craft market. We are a very happy and helpful community. I stand behind my community, and I do not believe any of them are criminals. I believe people act in civil disobedience to make change, and I stand behind that. And I hope that you guys understand the true people that we really are. And I hope that you guys see that we deserve to be here as much as anyone. And my recommendation for the City of Toronto is for a public-private partnership.
Thank you so much, first of all, Mr. Chair, and the members of the committee for giving us this opportunity to speak on the recommendation to help with the legalization process. MMJ Canada, we have 10 dispensaries across Canada, and we employ over 150 staff. And that, on a projected basis, this year alone is going to be plus $5 million in payroll that are pensionable earnings. So of which it's 1.3 million would be allocated to paying taxes, CPP and EI, and of course we file now, because of our sales now, we file on a monthly basis. Everything's on time. We want to make sure that we file our CPP taxes on behalf of our employees. So we are a legitimate business, but just in the illegal framework. Now, we want to be as transparent as possible because, again, we are a legitimate business, a corporation. We put all of our staff, all of 150 of our staff through a 90-day training program. And after that 90 days, they go through a course that's taught by the Trichome Institute, who's based out of Colorado, on the responsible vendoring. Basically teaches them, the different strains, how to, educate the patients that come in, and if they're diagnosed with, certain, symptom, then our service advisors would certainly be able to educate them on that because they've gone through the 3 hours of training and also the 1 hour of tests that they have to do to get that certification before they can actually serve our patients. And we also have something called the the Employee Vision Program that we've implemented recently. That allows our employees to suggest ideas to help us as a company move forward from a health and safety perspective to increasing productivity to how better we can service the community. Now, that's just to show that we are a responsible vendor and we want to make sure that we adhere to the higher standards. Obviously, there has not been a standard that's been set by our government, and I'm quite surprised that no one has approached us. We are one of the biggest, and we are one of the ones that have been in industry. We are one of the ones that have created the framework to really assist our government. And I'm quite surprised that we haven't been approached to see or open our books to our friend the government to be able to either mirror that structure or improve on that framework so that way that it can include everybody. Now, most of us here have children. I have my son. His name's Damien. He's turning 3 years old in December. And he's a huge sports fanatic, and I want to put him through the training for the next 15 years, so that way one day when he's ready to go on the international stage, that he can represent Canada in the Olympics. Now, 15 years from now, just because he didn't go through a program that the government has legislated or proposed, that doesn't mean that he's not qualified to compete against the best in the international stage. Now, this is not really about MMJ Canada or money anymore. This is about international reputation. We should be the ones that's setting the standard for the world. And by not including dispensaries, we're going to be falling behind in international stage. If we don't get an equal chance to participate in the free market, we are basically challenging the growth and expansion of democracy in our home native land. And by us having the standard and setting the standards out already, and that we would be able to partner with the government to ensure that that framework is there to help them with their 60 to 120 stores. That would also include us as well for the ones who came out with that structure to be able to help them. That says there's two steps into this process here. One, not only the government is holding us to our standards, but we're also holding a government to the standards that should be out there, that should be legislated, that should open up the free market for everybody to operate in a responsible manner. Now, you're going to hear a lot of people talking about stakeholders. Yes, $1.3 million in taxes, CPP and EI, that's only us. What about the other stakeholders that are involved? The distribution, the fulfillment, the corner store, pizza shop. So if you are not including dispensaries as the model into this model, you essentially limiting the growth from an economics perspective, and also shutting out the talented people and individuals that who are not recognized anywhere else for their specialized skills and experience. So we are the creator, and I think we should be included in that.
And one more thing, sorry, since we have a minute left. I know a concern a lot from councillors and people on the outside is our supply and where we get our supply from. This is something that has bothered me for a long time because we've been asking for supply chains. We get our cannabis from MMAR growers, and they're not included in this new regime, and we've been begging. I go around to different LPs, and I take tours of their facilities, and I sit down and I have lunch with them, and I try to pick their brain, and everybody seems to be handcuffed by the government's decisions on not to allow an open market where the LPs can work with us and we can work with the government and have a nice circular flow. That's been an issue so far, and I wanted to address that because our hands are tied when it comes to our supply chain, and we want that change as well.
And I'd also just like to add from a security perspective, I have 10 seconds left. We recently had our business license granted by the city of Nelson. Now, we actually, that's out in BC, so we actually didn't even have a building at the time, but our security proposal to the city of Nelson ranked 4 out of 5. So that's just to say that we are conducting our business in, as safe, as possible. And given the fact that we are not recognized yet by our government, that doesn't mean that, we don't have the standards set out nationally for Canada. And a lot of countries are looking at that.
Thank you.
And if we don't have that, it's game over.
Thank you. Questions? Councillor Burnside.
Thank you. So, sorry, how many dispensaries are there in Toronto?
How many dispensaries in Toronto?
Just approximately.
Yeah, last time I heard there was about 190.
190, okay.
Are you talking about industry-wide or?
No, in Toronto.
Or MMJ Canada?
No, industry.
Oh, like, do you want just Ontario or nation?
190 is good, that's all I
okay.
need. It's a very general question, but thank you.
That's
okay. So, even if one were to concede that your supply is whatever, safe or not through organized crime,
yes.
Do you vouch for the other 180?
I'm not here, I'm not here to make judgment calls, but if
I'm not asking you to judge.
Yeah, well, I can't vouch. I'm the CEO of MMJ Canada. I vouch for my own company.
You're only talking about your specific 10, right?
Yes, but
okay, thanks, that's fine. Okay. In terms of government involvement in the sale of cannabis, I'm trying to understand, are you against that?
No, as I said, we wanted a partnership. We want to work with the government. We want to have a supply chain. We want to be able to be involved. We know that the government needs majority of control. We understand that there needs to be a standard set, and you guys want to make sure people are safe and it's being done right. We get it. It's the first time. What you guys are doing is nothing short of amazing, and you guys are being put in a very complicating position to try to appease 30 million Canadians. All we want is a little bit of the market so we can exist, so we can do what we do for the community and give back, so we can continue to be small businesses and survive in the life that we've created for ourselves and for, MMJ alone, 190 other employees.
Yeah, I mean, okay. So you're okay with some sort of LCBO involvement? Some form of that.
I have no problem with some format of the government being involved as long as it's fair to the open market where dispensaries and other people are also included. Yes, I am totally open for that.
So you'd be okay. So, I think another person mentioned something about bakeries and restaurants.
Yeah.
Would you be okay with that sort of model where the LCBO, want of a better term, sells sort of, I'll say, more the home consumption bulk items, but people could go to a
CCBO to get it,
something like that.
Yeah. Okay. So I guess correct me if I'm wrong, sir. That you said that would I be opposed to the CCBO selling baked goods? CCBO selling baked goods and other.
No. Sorry, I meant the CCBO.
Yeah.
Would be selling whatever amount.
Yeah.
But that private enterprise would be more like a restaurant that sells a glass of wine.
Okay.
If you want to use, I'm using the analogy, of course.
Yeah, so to me, as long as there's a model set in place that seems to be fair, I think on our side of the industry anyways, and I'm not going to speak for everybody, but from MMJ Canada's point of view, is that we just want to be included in some part, but we want it to be fair. We want our voices to be heard. We just don't want to be completely shut out. And as of right now, we're being completely shut out. That's what we've been told. And that is a concern for a lot of the people in here because there's a lot more to, everybody just keeps saying the organized crime, and nobody's talking about the positive things that these people in the industry are doing to give back to the community. I don't know why that's not recognized.
Well, I think, there's probably two different issues, right, in terms of positive things that any good or bad person.
What I mean is that why wouldn't you want these brands in the new market is what I mean. So if there's these positive brands that are doing good in the community, why would you want to eliminate them from the new existing one, especially when they've been around for 15 years and they've helped set up the structure of distribution?
I can't say that's the province, but it's probably similar to them not asking the Kennedys or the Bronfmans for
true.
advice.
Yeah, very true.
Thanks.
Thank you.
Thank you. Any other questions? Deputy Mayor, if I may.
Great through you, Mr. Chair, and thank you very much for coming in today. Sorry, I missed the name of your business?
MMJ Canada, sir.
MMJ?
Yes, MMJ.
And how many storefronts do you have in Toronto?
We have 2 in Toronto, and we have 3 in Hamilton.
Okay, and in Toronto, because that's municipality,
sure.
I know, the dispensaries are illegal, correct?
Correct.
So your MMJ Corporation and you're 2 of the CEOs, you have knowingly and willingly broken the law and conducted an illegal business, correct?
Yes. Essentially, yes.
So could you understand why we might hesitate to do business with you?
Yes.
When there may be other business people like yourselves who are saying, you know what, I'm going to wait, I'm going to obey the law, I'm going to wait till the government comes out with its regulations and then hopefully I'll follow them. But you've decided to purposely do things illegal every single day of the week. You know it's against the law. You flout the law. But today you're saying, you know what? Maybe you should just let us in. Next you may tell me that you're going to start selling alcohol in your dispensaries, and selling alcohol at a dispensary is illegal as well.
And we understand your concern, sir, and I greatly appreciate your point of view on that. Now, the problem is clearly the way the regulations have been rolled out is that it's favoring big corp in the government and not small businesses. So the reason why we came early, so we could show the government that we can self-govern ourselves to a certain standard. And now I know that not all companies uphold what you guys think the standard is, but there's a lot of people who are trying, and there's a lot of people who are working with other cities. So I don't understand. So it's illegal here, it's illegal in Vancouver, it's illegal in Nelson, but yet Nelson and Vancouver are deciding to work with these illegal dispensaries who have just been doing what they want for 15 years and incorporating them. Now, it doesn't mean we're going to come to Toronto, and if you give us a little bit, an inch, we're going to take 3. You give us 3, we take 5. Give me a rope, and I want to be a cowboy. That's not going to happen. We want to adhere to what you guys have to say, but we're not even being heard, period. And that is a major concern. This is the first time that anyone's ever approached us or even questioned us about our business. I've been waiting for the day that people come into MMJ Canada so I can show it off and show the people that what we've done to give back. I'm very, very, very proud of what we are doing to give back to the community and the services we provide on a store level front.
Right. All of it, though,
is illegal right now.
Illegal. So what gives us any assurance that if we set a regime for dispensaries, you say, oh, that's great, that you'll just break the law again, because you'll say, well, now you've got a category, say we legalized it, which we can't do. We had another regime for rules for public safety, then you're going to say, well, any rule that I don't like, I'm just going to ignore and engage in illegal activity, because you've already done it. Right? You've shown us who you are.
Right, absolutely. Thank you so much for that, sir. And now, the reason why we're operating illegally is because there really isn't or wasn't a regulation set in stone.
Right. There was a prohibition. For us. There was a prohibition.
Yes, right. For us to follow. Right. And to be pioneers in this industry where our nation's one of the first to acknowledge that marijuana is,
one of the first?
One of
they were
one of the first.
We're one of the first. we're one of the first. We should have been ahead of the U.S., but now we're lagging behind. It's because there's not enough pioneers like ourselves to be able to challenge the status quo. Now, we're not challenging the government. We want to work with the government. We're not challenging them at all. But it comes to a point where if we're setting the stage for the international game, we have to adhere to the standards, and there was no standards. So we are the one that's creating that standard for the rest of the industry. Sir, have you been to any of our shops at all, or as a matter of the committee here, has anyone been to our shops?
I suggest you guys all go into our
Highly
stores.
suggest, and Clint and myself will take you on a tour, and you'll see exactly why. We get rated once, and then we get, left alone after that, is because we're structured properly. It's because we treat our employees fairly and that we treat them with respect. And it's because we pay our taxes on time. We're not, I know a major concern is that you don't know how to tax the cash portion of
So if I can jump in, 'cause I
revenues.
have a limited time as well.
Sure, yeah.
So if I have if you two start a construction company next week.
Okay.
And you ignore all of the fire safety hazards, all of the accessible standards, any regulation that you don't like, should I then legalize your construction?
Absolutely not. That's definitely another topic in itself, but I'll let Clint go at it.
Now, real quickly now, so you say that if you give us the benefit of the doubt, we've already proven to you that we're breaking the law, what would make you feel that you'd be confident in giving it to us?
Right.
Now, why is it that Vancouver, when they have done this in Nelson, everybody is operated illegally all across Canada, from Nova Scotia all the way to Victoria? So Victoria, Vancouver, Nelson, they do not believe that these things are going to have a ripple effect of us keeping the black market point of view if we get regulated. In Vancouver, the process alone to fill out the licensing form, Sean can vouch for, is like hair pulling, and it takes forever. And we've gone through all all the processing that we have possibly needed once we've been given the opportunity. I think that you think that our industry is very vindictive. We're a very passive industry. All we want is to be accepted and included. And I believe if you do give us that benefit of the doubt, you will see people follow more rules. You will see people adhere to anything that not anything you guys say, but majority of the things that you guys put in place for a structure.
Okay, thank you, Mr. Chair.
Yeah, thank you. Vice Chair Caracas.
Thank you. Through the chair to you, according to my colleague, supposedly you are an illegal entity and therefore you shouldn't be operating.
Yes.
Actually.
I'm just wondering, this is something comparable to Uber.
Yes.
Uber was illegal.
Yes.
We legalized them, and to this day, they're continuing to operate still illegal. A lot of their cars got to have decals in the back, and they don't have.
Okay.
I'm sure this will not be the case with you once we legalize you, or we're allowed to legalize you.
I think it'd be a little different. I think for you guys, when it comes down to the regulations that you've put in place for the growing side of things so far, sir, the LP, the licensing and the structure in the security processes that they have to go through to complete the process is very, very hard. I think when it comes to storefronts, if you set up a system that is restricted, not restricted, fair and reasonable.
You're going to be in one place. You will not be moving around.
Exactly,
like
yes.
Uber.
We're not a car.
Therefore, you would be more easier for us to target you if we need to target you, and you will be adhering more to the rules than Uber.
Yes.
Exactly. So to summarize that, my colleague certainly referring to that, he was probably forgotten the thing about Uber, and maybe he was wrong, but that's another situation, another story to deal with. However, having said that,
I didn't support Uber either. Neither did you.
At least he's consistent.
Members of council, please.
You have to be consistent. So has your industry, and I will ask that question of as many people as I get to ask, has your industry been approached by the federal government and or the provincial government to talk to you about how you dispense cannabis?
No, not at all, sir. Everything that we've done, we've had to learn or go figure out.
If I think it's called the Dirty 13 or the Dirty 15, whatever.
Okay.
This was in the previous government. Had they been approached?
I'm not quite sure, sir. I focus a lot on my own brand, as there is a lot of work to be done having mental health organizations and fundraising divisions. So I stick to to our company.
Where do you get your cannabis? Do you get it legally, or do you
We get it from MMAR growers, and we are now looking for suppliers, which is almost next to impossible with the regulation set up, to be getting it from one of the licensed
It's not
producers.
like marijuana that comes in.
No, we're not going to, I'm not going to meet a guy in the back alleyway and then going to put it in a knapsack and throwing it into my shelves. Like, these people are medically licensed growers. They're just not under the regiment that Canada has set up, which is a flaw.
The province is looking to legalize the selling of beer and wine at the corner store, and yet they're looking to put the boots to you. How do you feel about this? I mean, is that fair or unfair?
It kind of really just, it hurts. You know, there's a lot of people here, and I'm far from one of the ones who've been here for a long time, sir. There's people that have been sitting in this room and have been amazing activists, and sometimes people don't agree with the way they go about things, but essentially they've been the voices of our community for almost 15 to 20 years. They've been trying to get...
Is your industry something that's self-regulating, and you try to weed out the bad apples?
Yes, of course. I think all of us want to be represented in the same manner. I think everybody, you know, wants to be respected and do things the right way. They want to do it their, you know, essentially they have their own twist on things. But yes,
So you'd be able to provide marijuana at a lower cost than the province. The province has to run stores that are, you know, the big outfits. They're going to have to be regularized. They're going to be unionized. So, but you can provide it cheaper.
Yes.
So somebody that suffers from post-traumatic stress disorder,
yes,
veteran or a frontline paramedic, or you know, one of our frontline individuals, fired, police, they be able to come to you much faster to get marijuana,
yes,
in order to relieve their pain.
Yes, sir. And then also, as well as with certain companies, again, I can't speak on behalf, but with MMJ Canada, I have worked out that we help 10 patients a year that we completely pay for their medication. So so if somebody does come in with PTSD and we know that they're suffering, and we have a sit-down consultation, if we don't have up to the 10 patients that we're covering this year, we will help someone, and we will cover all their costs doing so.
Do you think that the government-operated stores will have the same regulations and facilities in order to help somebody that is suffering and give them personal care as you do, or will they be more interested in the bottom line, let's make money for the government?
It's the bottom line. It's going to be treated, if they're going to put it in a CCBO model, they're going to probably treat it like the LCBO. And you know, I've been in the LCBO plenty of times, and I've never gotten the customers.
Therefore, if I was to summarize, your industry has been thrown under the bus in order to fulfill the needs of an election that's coming up by the provincial government just around the corner. Am I being correct?
Essentially. I'm not gonna, you know.
Sorry, that'll make.
We will not comment on that.
I'm not gonna comment on that, Jim. But you know, however you're viewing it is your view.
Any other questions? Okay, Councilor Luciana.
Just comment. First of all, I don't buy your argument. What you're trying to tell us is you want to work with the government, and what you're trying to tell us is that businesses that are operating illegally, we should allow you to operate illegally, ignore the rules, and allow you to operate.
Who said we'd be illegal? If you regulate us, that means that we're not illegal.
Well, please don't interrupt. I'm asking the
Chair,
question.
point of order. Chair, point of order. I don't think that, I mean, treating our witnesses aggressively.
I don't appreciate being interrupted when I'm asking a question.
You made an assumption, ma'am, and you told me you weren't buying my argument.
That's not actually point of order. Councilor Luciana, please continue.
Yeah, so you're saying you want to be you want to give back to the community, and you know, so you're operating an illegal business. So why should we ignore that and close our eyes?
Nobody said to ignore that, ma'am, at all.
Absolutely not. You should not ignore that.
No. Like, I don't buy your argument.
That's fine, ma'am.
You're operating illegally, and
you've heard one thing out of the whole statement, so I appreciate
every illegal business that's
that.
operating illegally, in my opinion, should be closed.
Yes, you're right. So thank you very much for your opinion, ma'am. Let's not focus on any of the other things that we spoke about, the $150,000, the mental health organization, the fundraising division. Let's completely ignore about all the positive things that these illegal dispensaries are doing, when you full well know they should be regulated and legalized.
Excuse me.
You're legalizing cannabis, ma'am.
Excuse me. Okay. I'm going to ask members of the public and also members of the committee that when you are speaking, speak respectfully at all times and refraining from using any offensive, disrespectful, or unparliamentary language about anybody at this point. And because that's not going to help. And anyone who doesn't do that is my job as chair to make sure that we maintain the quorum and civility in this room. And if that doesn't happen, I will ask security just to remove anyone, whoever it is, including members of council. Thank you.
So are there any other questions that we can answer this time?
We are done with questions, sir.
Thank you very much.
Thank you.
Appreciate it. Thank you.
Sorry, Ralston, the next speaker.
Where is this? It should be Jamie Shaw. Yeah, Jamie Shaw.
Is Jimmy Shaw and Zoe Brownstone.
Thank you very much for your time and attention in this matter. I actually, just before I start, I just want to kind of clarify something from the previous discussion. The government says dispensaries are illegal. The courts have actually not found that. Hamilton just lost an injunction trying to close down a dispensary. Saskatoon was ordered to let a dispensary stay open as long as they were serving edibles because they couldn't get it anywhere else. So the question of whether dispensaries are illegal or not is, there's no question in terms of the government's mind, but there is in terms of the court's mind. So my name is Jamie Shaw. I also work, like the two previous speakers, for MMJ Canada, but I'm not here to speak on their behalf. Prior to that, I was working for the BC Compassion Club Society, and I was president of the Canadian Association of Medical Cannabis Dispensaries. And while I'm not here to speak for them either, it was during my time there that I lobbied successfully for and consulted on dispensary regulations in both Vancouver and Victoria and other cities since leaving those organizations. It was my testimony in the Allard trial that Justice Phelan described as very important because dispensaries are at the heart of access. What convinced Justice Phelan and Vancouver City Council and Victoria City Council and others wasn't me. It was the overwhelming evidence that enforcement does not work. It didn't work in San Francisco, doesn't work in Los Angeles, it didn't work in Hamilton, Saskatoon, Halifax, and it's not working here in Toronto. While it's easy to blame the explosion of dispensaries on the election of a government promising legalization, that does not explain the long history of this pattern. Long enough that I've actually expressed this to some of the people in this very room, that this was what was coming, that you were going to see an explosion of dispensaries, and that happened back in 2014, well before there was a Liberal government in power. This is a multifaceted issue with many drivers, which is why this same pattern plays out again and again, regardless of jurisdiction. The recommendations made in this report seem largely oblivious to that and other factors, but it is the first two recommendations that are most troubling. Recommendation 1 calls for support of the proposal put forth by the Ontario Liberals for provincially controlled stores. The Ontario government can't wait to get into a business the federal government couldn't wait to get out of, and they're doing it by making a lot of the same mistakes that were made in the early federal programs. It should be recognized that there needs to be a mix of private and collective ownership of distribution as well. Treating cannabis like the much more harmful alcohol and tobacco in every way except in terms of access is remarkably hypocritical. Not to mention that trying to replace the existing market with stores carrying only products that licensed producers are currently allowed to make, that will number 150 3 years from now, is an exercise in futility. It's also interesting to note that the same Board of Health decision the report cites as justification for backing Ontario's plan also cites that there should be an immediate call for decriminalization and measures to address the fact that communities are over-targeted. Instead of echoing these calls, more enforcement is recommended. This will not address the underlying issues of access and the fact that both the public and the industry are at least 20 years ahead of the government on this issue. What this increased enforcement will cost is addressed simply by saying the province will pay for it. And so the financial impact section claims there will be none. There's no number or estimate of cost, but it does refer to a subsection entitled Cost of Implementation and Enforcement and Funding. There's no number or estimate here either, but it does say the city will require additional resources for 6 or 7 different city departments. It also states that ML&S officers and Toronto Police have been redirecting resources for enforcement efforts aimed at closing the illegal storefronts that have proliferated since the spring 2016, and that they expect this will continue, but there's again no number or estimate of cost. Just to fill in some of the missing math, the Vancouver Police have said the cost of a single investigation can be up to 560 police hours, or $34,000 in salary and benefits, and that was 3 years ago. It doesn't include any other costs either, but it's a number to start from. Lawyer Jack Lloyd has said there's at least 1 dispensary a week getting raided. So without factoring in Project Claudia, Lincoln, or Gator, that's $2.8 million spent so far just in police salaries just to maintain the status quo. Add in all the other costs and multiply that number by 2 or 3 and you might finally make a dent in the number of storefronts. But that's just the people willing to operate openly. That doesn't touch the supply, it doesn't touch pop-up markets or online sales that are already prolific both in the city and in the province. And while the city may feel that there's no financial impact because the province paying for it, there is an impact, and it's a large impact. And whether it's the city or the province paying for it, it's coming from the same taxpayer pockets. And that's just the financial cost. To restrict access to cannabis at a time we are facing an opioid epidemic is the height of drug war stupidity, especially when many are prevented access through the ACMPR due to numerous barriers such as physician colleges suggesting cannabis not be recommended to people with addiction issues and other barriers as well. In 2001, the same court decision that forced the government to create an avenue for medical cannabis also recommended they turn to dispensaries for their knowledge and expertise. 16 years and multiple unconstitutional programs later, it's frankly depressing to see so many branches of government continue to ignore this court recommendation. I urge Council to amend this report to include not only a call for private retail as backed by the Ontario Chamber of Commerce, but also a call for the provincial and federal government to heed the wisdom of numerous court decisions and recommendations related to cannabis and consult more heavily with the existing cannabis industry, legal and otherwise. Thank you. No clapping. Thank you.
Councillor Jones, go ahead.
Hold on.
There is a question, ma'am, for you. Sean?
I'm back. I'm going to ask you the same question that I ask others. Your knowledge, yourself or anybody else in the industry, were they consulted by the federal government and or the provincial government before these announcements were made?
Not entirely. I was actually submitted to sit on the task force by the City of Vancouver, but I never heard from the task force and I was not invited to participate in those roundtable discussions. I know 2 members of the Standing Health Committee in Parliament actually submitted me to speak there as well, and I did not get an invitation to speak there either.
So the province and the city, in the province of Ontario has come out with recommendations. And you have not heard from anybody in the industry if they were consulted and how they came about it?
Yeah, no, exactly.
Thank you.
Thank you.
Thank you. Zoe Brownstone, followed by Tyler James and Kyla Caracas. Hello there.
Hello, I'm a representative of the Ontario Cannabis Consumer and Retail Alliance. The proposed model the provincial government has put forward in the regulation of the sale of cannabis in Ontario does not meet the realistic requirements for recreational sales in this province. The federal government has provided the provinces with a unique opportunity to decide on how they will regulate. Toronto is not only the largest city in Canada, it is one of the fastest growing cities in North America. As a city, province, and country, we have a small window to step ahead of the curve and become leaders in this industry. There have been too many comparisons of cannabis to alcohol in terms of health and safety, sale, and licensing, when really a more appropriate comparison would be cannabis to the dot-com boom. Similar to the plant itself, this market is growing everywhere. Colorado now makes more money in the sale and taxation of cannabis than alcohol. In 2015, the cannabis industry in Colorado created 18,000 jobs and generated $2.8 billion in economic activity. This is due to Colorado's licensing and taxation structures which allow private businesses to exist and thrive. The pre-existing industry has learned and developed working models for cannabis sales. Safety, education, community outreach, these are key elements of cannabis businesses in Toronto who believe so strongly in regulations that they have created their own. People who have been working in this landscape for decades understand the unique demands and challenges that it entails. These business owners and operators are also sensitive to the ever-evolving customer and patient groups who require a wholly unique approach that must include education, confidence, and transparency. The cannabis industry will only grow if there is a fundamental structure built of knowledge, inclusion, and accountability across the board, from seed to sale. The proposed method for cracking down on so-called illegal dispensaries is an antiquated approach, raiding storefronts where patients are accessing medicine as if these stores are similar in any fashion to the speakeasies of the last century. The limitations put forward by the government over legal medical cannabis currently forces patients to ascertain their medicine through alternative methods, and as a result, they are treated like criminals. This is not going to change if the government does not allow an open market where patients have access to a wider variety of products, vapors, oils, edibles, etc. There is no black market. There is a gray market in which businesses who practice ethical sale and education of cannabis exist alongside those who do not adhere to any responsible standards. Consumers have demonstrated both in Canada and the United States that they prefer storefront retail of cannabis. The best option is a public-private partnership. It is therefore the responsibility of our government to regulate and protect these businesses so that proper access is granted to both medical and recreational users. Before any regulations become finalized, there should be at the very least consultation with these businesses. Thank you.
Thank you. Questions to the deputant? Thanks so much for your presentation. Tyler James, followed by Kyla Caracas. Good afternoon, sir.
Yes, good afternoon.
Please go ahead. 5 minutes.
Thank you. My name is Tyler James. I'm with Eden Medicinal Society. We're a federally registered nonprofit that opened its doors to its first dispensary in July of 2011 in the heart of Vancouver's downtown east side. At the time, Eden sought to provide compassion to a neighborhood that suffered from a lack of economic development and access to alternative forms of medicine, including those suffering from addiction. This is a mandate that we continue today through our Vancouver and Toronto locations. In regards to the province of Ontario's plan for distribution, it's ill-advised, and we believe that the city's subsequent recommendations require further input. It appears not to be informed by detailed medical and industry research and is void of input from community outreach organizations and dispensaries that are currently fulfilling the need in the city. Falling in line with the provincial plan pushes organizations to the fringes that are active within the community and does not address the black market supply that will still be accessible, likely more so under the proposed public-only model. The province has not detailed the cost to taxpayers or the logistics as to how the public-only distribution model will be rolled out. We are here to offer our industry intelligence to improve the success of a cannabis distribution plan in Ontario that is inclusive of current stakeholders. 150 locations will not meet the province's needs day one of legalization, let alone by 2020. Colorado, a U.S. state with 40% the population of Ontario, licenses over 500 compassion clubs and dispensaries, all of whom pay licensing fees with revenues allocated to the municipalities. We are recommending the city explore a public-private partnership, which includes provincially licensed storefronts, in addition to the proposed CCBO outlets, which will ensure public safety for all end consumers, especially our patients. This will offer greater accessibility to drastically reduce the black market faster than dispensaries currently are doing so, all while providing multiple revenue streams for the city. There could very well be a change in provincial government next year before legalization, so we deplore the city to have a contingency plan should the current government change before that date. Similarly, in the 1970s, Donald Zeraldo was successful in obtaining permissions from the LCBO to produce and distribute wine, in essence giving rise to the current public-private partnership that exists with wine distribution today, showing that these battles do not have to be done solely within the judiciary. Legal precedent has established that Canadians have a constitutionally protected right to readily accessible medical cannabis products and its derivatives. Our civil disobedience has influenced positive change, not only in the eyes of our patients, but in the court system and in public opinion. It's time we stop having these conversations just in courtrooms. People turn to Eden for our advanced knowledge, providing a kind of personalized attention, education, and service that is, quite honestly, unavailable elsewhere. This will allow for our patients to make well-informed decisions. It's in using this knowledge that Eden is partnering with the University of British Columbia on a new research program for opiate substitution in British Columbia, using standardized capsules and opiate dosing under the supervision of professional researchers applying constant analytics. Eden believes individuals who use opioids can reduce their intake, monitor themselves with support, and ultimately detox opiates entirely from their lifestyle using medical cannabis. An early Eden program pointed to a 50% reduction rate in effective substitution. Eden is proud of its role in the movement, and we will continue to push forward for the access of legal cannabis to all Canadians. I thank you, and I'm open for questions.
Thank you for your presentation.
Yes.
Vice Chair Karichanis.
Thank you. Sir, how many storefronts does your company have, or are there people that you represent?
Yes, Eden, we operate 5 storefronts across Canada.
In other provinces, has Eden, is it at risk of being closed?
We currently have 2 locations in Vancouver under municipal license, so those do not have the risk of closure currently.
Has Eden, as one of the mid-size or smaller-size companies, been consulted by the province of Ontario or the federal government on how to proceed with this?
I handle the community outreach and strategy with Eden, and under my direction, we hired a firm by the name of Council PA to assist us in our lobbying efforts to spread both awareness and to approach various levels of government to advise them on the best approaches going forward. However, they refused to hear us speak.
They didn't choose to hear you speak?
That is correct.
So you were not invited to go and speak?
Unfortunately, we were not.
So this decision that came about just came about without anything that you were asked to speak, participate, and or give advice to, and or even pick your brain, if I can say it that way.
Given our willingness to offer such intelligence, unfortunately, it was not expressed that they would be interested.
Have you heard of any other mid to small size dispensary operations being consulted to speak with the government?
Unfortunately, none have been.
Do you know if the MMRs, I think those are the bigger companies, if they were consulted?
Sorry, do you mean like the licensed producers?
Yes.
Oh, absolutely
they were called in the previous government, I believe they were called the Dirty 13. There was a decision made and the government just sort of like said, okay, here you go, you can only the ones that grow it. Were they consulted, do you know?
Yes, they were absolutely consulted.
So the scheme that was there before continued, and the only people that were consulted are the bigger companies that are actually in the business of making multi-million dollars.
That is correct. Currently, right now, really what we're pushing for is an inclusive market that would allow for women, people of color like myself, First Nations and Indigenous people as well to participate. Unfortunately, under the proposed regime, that will not be possible.
There's cigarettes that are sold illegally, and a lot of them are made in First Nation communities, and people go and buy them, and they bring them out and they sell them. Do you foresee something similar like that happen with cannabis?
Well, I believe with the 40 locations, those are to also service First Nations, correct? If I'm not mistaken.
I'm not sure.
So I do believe that, yes, there will still be a proliferation of the black market because really this is a fight regarding accessibility.
So we're going to push, creating those 40 stores, we're going to push the market in the back alleys, like booze was back in the 80s and even sometimes today where people go in the States, buy it and they bring it up and they sell it for cheaper.
To be quite honest, living in the time that we're at now, it doesn't necessarily have to be in a back alley.
But if we proceed down that alley, we'll be ended up in the back alley.
Yes, the black market will proliferate again more so.
It'll be on your phones.
Yeah, order it through Uber. Uber would deliver. Thank you, Councillor. Uber cannabis. Uber Eats, Uber cannabis. Thank you. Thank you, Speaker. Thank you, Speaker. Thank you.
Okay.
Thank you.
You know the rules.
Just the last question, sir, that I will ask of you. Is this the only time that your industry had an opportunity to come forward and present its view?
We have chosen every opportunity to come forward. However, they have been quite limited. So yes, this is one of the few beyond us hosting our own events within the community, yes.
As a follow-up, you had an opportunity to come and make deputation twice before. Unfortunately, we shut you out. If you were able to speak in the previous session, do you believe that our city sitting around the table might have voiced the difference concern to the province, and maybe your voices would have been heard?
We are willing to expose ourselves to the highest level of due diligence in order to meet requirements to be able to dispense, and we would have been able to expedite this process, yes.
Hold on. You were not heard twice before.
That is correct, Your Honor.
Had you been heard twice before, do you think that the province might have had a different view of if what you heard and reported through the media and that the City of Toronto represented those findings, or what we heard from you at the provincial or the federal government?
I don't believe that at the provincial level they cared enough to include us in the first place.
It didn't include you, right? But had we heard you, do you think that maybe it was a different outcome?
From what we are hearing on the provincial level, it would have only changed public opinion.
Okay, thank you.
Thank you. Kyla. Followed by Jodie Emery and Miguel Avila. Please go ahead. Good afternoon.
Everyone. Thank you very much for having me. I am here on behalf of the many legally licensed medicinal cannabis patients who feel as though the current proposal for recreational marijuana legalization negates the needs and the accessibility to medicinal cannabis patients across the province. I myself am proof that the effective consumption of cannabis can replace the use of narcotics. Through the use of cannabis, I have been able to treat a variety of ailments such as anxiety, depression, fibromyalgia, disc herniation, spinal degeneration, chronic pain, and nerve degeneration stemming from a motor vehicle accident. Prior to cannabis, I was being treated with a handful of prescription medications, in addition to physiotherapy, chiropractics, and multiple nerve blocking agents administered via spinal injections on a weekly basis. It was never a question or deliberation as to whether or not I would be able to find a safe and conveniently located pharmacy through which to purchase prescription narcotics. So, as a result, I'm appalled as to why deliberation continues to exist regarding whether or not we, as patients, should have the same legal and comparable access to our medication. Medication that does not deteriorate the functioning of vital organs, medication that does not make us as patients more susceptible to addiction, and most importantly, medication that does not further impact any mental or physical ailments that we are already trying to mediate. Many patients possess medical recommendations that can currently be fulfilled through access to compassion clinics located all across the Greater Toronto Area. Purchasing products that have been meticulously grown, lab tested, and whose staff is appropriately trained and immensely informed on both the psychoactive and non-psychoactive properties of cannabis. I have placed orders through the appropriate channels to obtain legally prescribed cannabis through Health Canada, and can attest to the limitations that many online ordering forums currently present. Often limited information is available regarding the benefits of certain products. The required dosages of certain products to remedy specific ailments is not accurately listed or available. And furthermore, the availability and accessibility of product is few and far between, depending on the specific medicinal needs. In addition, the licensed producers are currently offering medicinal cannabis inadequately. They are inadequately able to provide access to legal cannabis solely for their medicinal patients. Therefore, it would be apparent that the supply versus demand when dealing with levels of consumption on a recreational level would also be in conflict. Thereby, it would create an increased demand of patients turning to the black market, defeating the primary purpose of cannabis legalization in the first place. As an individual advocating at the ground level, working amongst various compassion clinic locations across the GTA, the feedback from many individuals, most of which currently possess their Health Canada issued licenses, is the growing concern that the current model proposed does not provide the knowledge base offered in already existing compassion clinics. In addition, the wide range of product available has limited their needs of obtaining product on the black market. And most importantly, they are now able to effectively provide immediate treatment and deterring the use of other prohibited substances, such as opioids and narcotics. The clinics currently exist under a business model built on compassionate care, safety, and ultimately choice, a choice that is the patient's constitutional right to maintain. In conclusion, in order to move forward with legalization, a partnership between the public and private sector while obtaining appropriate licensing is vital to achieve safe, informed, and regulated access to cannabis at the recreational level. Thank you.
Any questions to the Deputant? Deputy Mayor De Bermeja, please go ahead.
Thank you, through you, Mr. Chair, and thank you very much for coming in today. So now I can't remember, was it 2002 medical marijuana was licensed, I guess? So I would assume then you've had no problem getting medical marijuana at all through government channels.
Well, initially, it was a bit of a rigmarole to obtain my medical licensing due to the fact that my medical practitioner wasn't actually on board with providing me with the licensing. I had to go through the Canadian Cannabis Clinic. They had to then obtain the information from my medical practitioner in order to be able to review it and issue me that license.
And then once you were authorized to get it, I don't know how long you've been using it, but you can go online, like you said, and again, you've got some problems with their website and it's not perfect.
Well, it's not necessarily the problem with the website. The functionality with the website is entirely workable. The problem that we face is whether or not specific product is available to meet the specific needs, because there are varying needs of multiple medical patients.
So that's through you, Mr. Chair. So that's really what you're saying, this dispensary helps you versus the existing government program, is that they have nice people at the counter who give you good advice.
Well, they have informed people at the counter. The fact that they're nice happens to be a bonus to it.
So informed people?
They are absolutely informed. They're knowledgeable with regards to the ailments that a variety of people suffer, and they acknowledge on a face-to-face basis exactly what could be helpful for the consumer.
Right. So through you, Mr. Chair. So so you're objecting to the provincial model now, but the provincial model will give you, we'll call it an LCBO, close to probably to wherever you live.
Right.
You'll be able to go there. Like you go to a dispensary, there'll be a nice and informed person at that counter who will help you. So,
well, to be perfectly,
aren't you happy?
I'm not so much happy, because in my personal experience, I can't go to the LCBO now and find an employee who's behind the counter that's able to provide me with a wine that's going to pair with my steak. So now you're asking me.
You can't?
I cannot. I
have
have yet to be able to.
You have to come to Cedar Brae Mall, close to where I live, because
Well, if you can-
I don't drink alcohol.
Yeah.
And every time I go in that store, I'm surrounded by staff telling me what I should be buying.
Wonderful.
You can't find staff.
I
to
have-
help
I
you
have yet to
buy a
encounter-
bottle of wine in an LCBO store.
Not one that can provide me with the specifics that I'm looking for. Absolutely not. I can walk by a variety of people who are available to stock shelves and point me in the direction of where their promotional vodka is, but I've yet to be able to ask anybody that's going to provide me with some concrete information as to what I'm looking for, and that's what we as patients are looking for from our consultants.
So at one level, if the LCBO model just made sure they had informed good staff, then you'd be happy. You wouldn't need the dispensary. If those nice dispensary people with the good information actually got paid better at the LCBO model and quit their job and went into the LCBO store, you'd actually follow them in there, because it's the same people giving the same advice.
Would I be able to see the product, or would it be behind a piece of plastic in a bag where I don't know what's contained inside, where I don't know what the availability is of that product should I choose to get it again? Would I know what specific ailments that product treats upon speaking to an individual or upon looking at the product? That I'm not sure that I can guarantee I can say that I'm comfortable with. No.
No, but it might be.
Yeah, it could very well be.
And then you would be very happy.
I'd think about it.
You'd think about it. Okay, I think you'd be very happy.
No problem.
Okay. Thank you, Mr. Chair.
Councilor Janis.
Thank you, Chair. Just for the record, after the federal government legalized marijuana and you were able to get it, and some of you were able to grow your own, wasn't there a period that was taken away from you between 2006, 2011, 12, and you had to give your certificate to somebody else to grow and he would ship it to you?
I myself have only been issued the medical license as of 2016, so I'm not able to speak to anything prior to that, no.
Okay, so 2016, are you able to grow marijuana, or you
I have never been permitted.
Okay,
No,
so the only thing you do then, you go on the website and you order it from the stores, and these stores...
I have a licensed producer through which I would normally go to be able to purchase the product.
So
my issue is the availability of certain products that work best for me and my best interest.
This retailer is not a front store dispensary, but it's somebody which is licensed to do this by the federal government, and they're somewhere out there. It's not a front, it's not a dispensary.
The entity, the LP that I am a part of, yes, they are an online licensed producer. I'm speaking on behalf of the dispensaries that I choose
Right,
to
but
purchase.
no, let's talk about that.
Yes.
Are you able to get different varieties?
Variety is very subjective. Variety could mean 3 and variety could mean 12. For the patients that are looking to...
Are you given, this through the chair, are you given the same kind of attention through this online medical producer as you're given at a dispensary, and be able to try different things in order to see what you need in order to cope with your day lives, be it if you're suffering from PTSD, suffering from cancer, or anything else?
I am not, no.
You're
There's nobody to speak to for immediate assistance. There's nobody to speak to where I'm going to get the answers that are required on a regular basis. Before I spend hard-earned money, I'd like to be able to speak with a person who's in front of me.
Not being able to do that, will that drive you around the bend and put you more in harm's way?
I would think so. I would think that any time that somebody needs to go elsewhere to purchase a product in lieu of an establishment that's already set standards, that's already set regulations in an environment that I feel comfortable in, that's clean and safe and accessible, I think any time you're deterring from that.
I apologize, maybe I was not listening, but can you tell me what you're suffering from in order that you need the cannabis? And
I was in a car accident that impeded the functionality of the discs in my spine. Fibromyalgia, I have disc herniation, I have ongoing suffering of anxiety and depression as well.
If for whatever reason you're not able to get that, how's your daily life?
It's increasingly frustrating. I have mobility issues that have impaired me from doing simple day-to-day activities like getting out of bed in the morning and physically dressing and clothing myself to my day-to-day functionality.
Give me a comparison of going to a dispensary versus going to a location like the LCBO. Is there a comparison that you can give me? I mean, if you had to go tomorrow to a location like LCBO where cannabis was going to be sold, what would be your comparison between those two?
You know what? I think the idea of going somewhere like an LCBO or a CCBO presents this idea that one size fits all. And unfortunately, the nature of this industry and the nature of the ailments that people are suffering from, you know what, an environment like that is not necessarily conducive to being able to go in and feel comfortable making a purchase like that. We rely on the other side of the coin, which would be the dispensaries who are providing us with staff who understand what it is, what we're trying to deal with.
We as a city are opening up locations where people can go and inject themselves and make sure that there's somebody that oversees it. We as a city are not working with you in order to accommodate what you need. On one side, you know, because there's a problem of opioid, let's go there, so we look that we do something, but in your case, we'll put the boots to you. Would that be correct?
Correct.
Thank you. Appreciate it.
Thank you.
Any other questions? Not? Thank you.
I hope I made a convincing enough argument for whomever was sitting right there that decided that she was going to walk out of the room.
Thank you, ma'am.
Oh, thanks so much.
Collect our marbles. And
the next one. Kyla? So the next deputant is me. Jodie Emery.
Good afternoon.
Good afternoon. Welcome. Please go ahead. You have 5 minutes.
Why are we legalizing marijuana in this country? Well, 3 reasons convinced the voters and taxpayers of Canada to support legalization. Those 3 reasons for legalization are that we have millions of Canadian fellow citizens who are deemed criminals for their choice to grow, consume, or share cannabis. We shouldn't be criminalizing those Canadians. The second reason is that we have an industry that already exists. It's worth billions of dollars. Years ago, it was worth billions. It's still worth a lot now today. And that industry is not going to go away. That industry is what we're supposed to be legalizing. It doesn't make sense to continue criminalizing the existing industry and call it legalizing. Then what exactly are you legalizing? The third reason to legalize cannabis is that our men and women in uniform, like family members I have, are enforcing laws that cost taxpayers hundreds of millions of dollars across this country. These laws cause harm to peaceful people, and they waste the valuable time and resources of our law enforcement officers. I am a new resident of this city. I'm out on bail right now. I was arrested in March by the Toronto Police for my civil disobedience. Peaceful civil disobedience is the only way that we've changed the marijuana laws in this country. The reason we have legal medical marijuana is because dispensaries and patients and growers broke the law, got arrested, went to court, and won. It's very similar to how Dr. Henry Morgentaler also broke the law to provide a needed service. The law changed, and he was given the Order of Canada. I'm not here to ask for the Order of Canada for myself or the fellow activists, but I am here to say that civil disobedience, the breaking of unjust laws that cause more harm than what the law bans, those are heroes in our movement, and they need to be recognized. But the proposed plan from the federal government, Bill C-45, which I testified to at the Health Committee last week, and the proposed legislation from the Ontario government are going to set you all up for disaster. The voters and the taxpayers are looking to you to not mess this up. And you, unfortunately, the elected representatives and the public servants, are the ones who will suffer when you do this the wrong way. We want to be legal. We desperately want to be legal. That's what legalization activism is about. But you deem us as criminals. And we can't get rid of that criminal label. Only you can. Only the government can. But when the government chooses to criminalize something, you create a crime. You create a criminal market. If you banned sugar tomorrow, your police would be very busy going after everybody for breaking that law. But the law does more harm than the substance itself, and that was agreed by the Senate of Canada in 2002 at senatereport.ca. There's a hypocrisy here. Again, think of your voters, think of your children, think of alcohol and tobacco, and how kids can buy cigarettes where candy is sold, where alcohol is sold as slushy drinks, and I walked by a wine rack and there were men in grape outfits giving free wine on the street, dressed in balloons. The hypocrisy here is offensive. Cannabis is a safer choice. For many people who want to use something safer than alcohol or opioids, they're being denied the ability to access that cannabis by the laws proposed federally and provincially. Even worse, we activists have broken the law, educated, done media, run for office. I tried to run for the Liberals for over a year. I've been a BC Green Party candidate twice. We do everything we can to reach out to you to say, please let us not be criminals. And yet you deem us as criminals and then accuse us of being criminals when we beg you to please stop criminalizing us. It's maddening. It's reefer madness redefined. And right now, what's even worse is that the very same governments that opposed legalization, that fought against us, that stigmatize us and try and draw our blood and take our kids when we use medical marijuana, deny us the ability to travel, deny us the ability to give back, those laws that you fought against us, you fought against legalization. Now the government says, okay, we're going to protect you from harm, buy our booze, buy our cigarettes, buy our pills, and now buy pot from us. And if you choose to sell it, we're going to send men with guns after you. That's not fair and it's not just, it's perverse. You're not only setting up Ontario and Toronto residents to lose the benefits of legalization, to create jobs, create revenue, get rid of empty buildings, pay leases, pay landlords, pay taxes, everything that these businesses could provide, that Colorado provide, where they build schools with marijuana money, you're denying taxpayers that opportunity. Even worse, if you support the Ontario government's plan, you're forcing every taxpayer to subsidize a multi-hundred-dollar billion industry in which the non-supporters of cannabis are forced to pay for the pot shops for the pot users. Why not get all the pot consumers to support these shops and raise revenue and taxes and create a net benefit rather than spending hundreds of millions of dollars extra on law enforcement plus legalization law enforcement plus a new bureaucracy? I'm just letting you know that over the next year, the voters and the taxpayers of
Emery.
Toronto will know about this.
Vice Chair Carichanis.
Thank you. You're obviously in front lines. You're advocating. You're getting politically involved. You're in the front lines. Has anybody from the federal or the provincial government in this province, besides throwing you in jail, been in contact with you to ask for your opinion as to how we move forward, the way that we dispense marijuana? Would it be through government controlled or continue in the scheme that we have right now?
I'm very pleased to say that Don Davies of the NDP invited me to testify to the Standing Committee on Health in Ottawa. They just wrapped up their hearings on C-45, and my husband and I gave the closing panel where you can watch us deliver this.
Sorry, my question was about what we do with dispensaries, not about legalization.
Nobody has consulted us. I've sent letters. I came here to City Hall to request interaction on this, but again, we are just accused of being criminals as though we're shady, dangerous people.
An individual suffering from post-traumatic stress disorder, be it a veteran, be it a first-line responder, EMS, fire, police, where would they feel more comfortable in reaching out? Would they feel more comfortable, in your opinion, in a store, something like the LCBO, or would they feel more comfortable in a dispensary just around the corner from their house?
Most cannabis consumers feel most comfortable amongst those who understand them and empathize with them, and dispensaries have been bravely opening themselves up to criminal persecution for providing this service. So we know that most patients would be most comfortable buying from those who are involved in the industry.
Do you know of any dispensaries that have gotten cannabis illegally and they're selling it? Or was most of the dispensaries that they're selling cannabis have been able to get it through the legal means?
Well, unfortunately, the law defines most production as illegal unless authorized by Health Canada. Now, you should reference the task force report, the Justice Department statistics on marijuana growing. They found that 95% of all marijuana growers who went to court had no connection to organized crime, were otherwise law-abiding citizens. These are non-violent Canadian growers who have been doing this in the shadows because the government refuses to let them come into the light.
The knee-jerk reaction of our provincial government by saying that we're going to get these 40 stores, 60 or 140, whatever it is, would they drive more people underground in order to provide cannabis and provide it more easily, more effectively and cheaper than the government?
Well, as the Chief Justice Federal Court, Phelan, said, that dispensaries are at the heart of access, and when dispensaries are shut down, people are forced to find other means. And I receive many messages from people, myself being an activist. They reach out to me and tell me about how they're now bedridden on opioid painkillers because the dispensary they went to was raided and shut down. That's harm caused by the raids.
We're not helping.
No.
The people that are suffering. We are driving this underground. Who are we helping?
Well, I wonder about this too, because again, we talk so much about the health and safety of our fellow citizens, and yet when you deny cannabis access, you force people to drink alcohol. And we know that alcohol contributes to rape, assault, theft, murder. Right now, our officers just finished up a weekend on the street where I guarantee you they had more problems from alcohol than from cannabis. As well as painkillers, like you mentioned, veterans. There are so many veterans who don't want to take these opioids. They don't want to be on those pills, but when they're denied easy access from dispensaries, they're forced to use more harmful substances.
If we as a city have had this hearing back when there was an opportunity for people to voice their views, do you believe it would have been beneficial that we were able to get these suggestions to the province, and maybe the province would have heard us? Not that they do, but maybe. Well,
our community and our industry has been begging for recognition and acknowledgement for decades. Long before I even began my activism 13 years ago, there have been nonstop efforts to try and engage. But when we get accused of being criminals, and when you see the list of everyone who's a stakeholder, none of those stakeholders include consumers or patients or dispensaries or those who actually are involved or affected by these laws.
My time is running out, so I'll wrap it up by asking the last question. Do you feel that we have let you down, and do you feel that had we done something else different, you wouldn't be in the position that we're putting the people, the stakeholders, and especially the patients at this very moment? Did we fail you as a city?
The City of Toronto has failed their citizens and taxpayers and will continue to fail them if they proceed as suggested at this meeting.
Thank you. Any other questions?
Okay, thank you so much for your time.
Miguel Avila, followed by Patrick Morrison and Chief Emery. You know the rules. 5 minutes. Please go ahead.
Hello, thank you. I have for you a chart, comparison chart of the police budget request for the coming years. As you can see, they're not making any mention of what money will come from the province when it comes to the enforcement of the new laws for criminalization of cannabis. Furthermore, rates of our cannabis dispensary clinics. I'm here to speak as a user of medical cannabis for the last 3 years and a half. And I want to request for you counselors is that this recommendations, number one, not to endorse it, please. Do not endorse the provincial plan because really is throwing these people under the bus and not consulting them and not who they have been longer years, long before the liberals were in power. So I think we're doing not a favor to these people. We are putting people out of work. In my clinic, they're very obedient of the law. They don't sell drugs to minors. They're all very kind and comfortable to people who suffer from different illnesses. And I don't think a provincial model or a monopoly will address those concerns. And so again, this budget, it shows that tomorrow, by the way, it's going to be discussed at the police board to see if we need more police officers in the city, and enforcement in the ways of resources currently. It makes me wonder where the money is going to come from next year. You asking the province to provide you with funds, but those funds don't have a number. So at the end of the fiscal year, are you going to be able to say to the province, we need more money for education, health, food at the table, or are we going to be asking them for policing money? When it's a situation that is becoming absurd that in the province, in the city of Toronto, we have police officers who are making over $100,000 a year. In my community of Region Park, suffer 51% of the children are in poverty. And I don't believe that the changes, the recommendations will have any impact in the Ontario and the province decisions. Caitlin Wynne is throwing money like crazy because she wants to be re-elected next year, and that's the bottom line. That's all they're doing is throwing money, money, money. But you know, in 2 years we're going to be asking them for money for our housing repairs or for our road repairs, and you know that. You know when they say no to the toll road highways in the city of Toronto, the province say no to that, and Mayor Tory says we need to find tools of revenue, and here's a great opportunity to do the same example of the city of Denver, avoiding some of the pitfalls or the problems they encounter, but we can create revenue, jobs for the community that really need it today. I will encourage you, members of council, to reject this plan and instead consult with the service providers, the consumers, the users, and perhaps we can create our own city of Toronto marijuana plan, distribution, dispensaries, all that in our house. We don't need the province. Really, the province is just benefiting the big friends, and we have to think opposite to what the province is doing in incorporating these small businesses who are working hard, paying their taxes, and providing a good service to many people in the city of Toronto. That's all I had to say.
Thank you, Mr. Avila. Any questions? Thank you. Patrick Morrison. Good afternoon, sir. Please go ahead. 5 minutes.
You can hear me? Great. All right, so my name is Patrick Morrison. I run the Kensington Market BIA. I might be the second person here who is not an activist. I'm not involved in the economy of cannabis. I have no skin in the game, as it were. But I do care about a just society. And I was motivated to come here to speak to you today just to reflect on a few things that the Ontario government is proposing and how you might be able to make more of a success of the rollout to legalization of cannabis in our society, and I'd strongly urge you to do so. As you may know, my neighborhood, Kensington Market, has a long history of welcoming nature and tolerance. It's well documented, and is at the core of why it is such a beloved neighborhood in Toronto, and also one of our most popular tourist attractions. We're the home to North America's second oldest cannabis lounge, Hotbox. You've heard from the owner. That business welcomes up to 500 visitors a day who consume recreational or medical marijuana, and primarily by vaping on the inside, but they also smoke out on a back patio. And for whatever reasons, besides the things I've just talked about, we somehow came on the front lines of this issue just when the dispensaries first started popping up in Toronto. They started popping up in my neighborhood. So I have a little bit of tangential expertise just in seeing things take off from the ground. Now, we no longer have that tremendous number of dispensaries, but there are still a few. They've spread all over the city, as you well know. There's clearly a strong demand. I'm going to talk about medical cannabis just for a moment, because we know that there are over 50,000 ACMPR. Again, I'm not in this world, but I'm told that's what people who are legally allowed to smoke for medicinal purposes in Ontario. And these people, and I've met some of them, I don't go to Hotbox often, but when I do meet cancer patients, people who are epileptic, people suffering from multiple sclerosis, HIV/AIDS, pain management, getting off of becoming an opioid abuser, someone with PTSD. We've seen that cannabis does have an effective medical application in society, and I think it's more likely that more and more doctors will continue to prescribe cannabis to patients. And I think we need to think about where we can have elderly people, locations where they can consume if they're in long-term living. I'm concerned about where these people can legally consume things. Elderly are often shut in at home alone. These lounges provide a social aspect that's useful for their health in a number of ways. One, to consume their medicine that they've been prescribed, but two, to maintain some kind of social connection in society. So I think that's an important point. I'm concerned, and I haven't given this the thought. I would urge you to speak with Toronto Public Health or something. What other locations, even besides lounges, might the people who are consuming this product for medicinal reasons, they need to have places where they can consume their medicine. I think that's a very important point. I'm just scrolling through something quickly here. There's also the aspect in these lounges and businesses where there's an educational component for the consumer, where staff are well-versed in not only varietals and strains, but also delivery methods. Again, vaporizing seems to be a healthier way to consume cannabis, and these lounges provide first contact, first use, and education on how these things are used. And I think there's value to that in society. I think ultimately we've covered off on a number, and speakers before me have covered off on a number of important things that this bill is letting us down on a societal level. We really need to encourage the province to rethink a few things, in particular where cannabis can be consumed, especially in mind of the elderly or people suffering using it medicinally. And I think the other important issue is fairness. I know that we're looking at LCBO, AGCO model. There are private places where you can go and buy wine outside of the LCBO. There are, I think that competition is good, and I think that the power of, and the small business can deliver competition that will reward consumers in Ontario.
Thank you, Mr. Morrison.
Thank you.
Any questions? Thanks so much for your presentation. Emery. Followed by Ben Respin and Adam Charney. Please go ahead. 5 minutes.
Good afternoon, Mr. Chairman, committee. I don't know the guys at MMJ. I did want to say I think they were mistaken in suggesting they're breaking the law. This is absolutely incorrect, and they've been herded into a false admission. These businesses would not exist if they were illegal. They are simply unlicensed. The city, the province, and the federal government are conveniently dismissing the rule of law and our Supreme Court as if it were entertainment. Next week, at an injunction hearing, I will elaborate on a little bit more in a moment, you are about to discover that the city, in fact, has been acting in an illegal manner. This will be a humbling experience for this committee. I hope we can be friends after this, and I really hope to convince a couple of you that you may be receiving the wrong information from the province. Ms. Emery was right. You are being set up. I represent a host of dispensaries where I help to strategize and mitigate the City of Toronto's enforcement actions around the current dispensary model. It is incumbent upon you to recognize and respect the Supreme Court, which supersedes municipal and federal laws. Current cannabis distributors do not exist through happenstance or out of pure civil disobedience. It is not a form of mass delusion. Current cannabis distributors are able to exist in spite of the CDSA and criminal code because of R versus Smith, R versus Allard, and the current ACMPR framework. These are profound pieces of legislation that allow distributors to exist. The Senate and the House have disregarded these important Supreme Court decisions, similarly to the hesitance to open the archives on the Ledane Commission's findings and other legislative reports, which marginalize and compromise the CDSA and CC, as Ms. Roach had already outlined around the charge of possession. At ground level, a municipality does not have the luxury of ignoring the desire of its constituents, who participate in over 1 million transactions per month through current cannabis distributors within the City of Toronto. Nor can the municipality ignore the rulings of the Supreme Court of Canada. If one provincial store gets built, let alone all 40 by July, even 40 would provide for one CCBO amongst 400,000 people. This would clearly allow for another legal challenge around one's right to reasonable access. Ontario's consumption rate is higher than that of Colorado. 700 storefronts exist in Colorado with a population 40% of the size of the province of Ontario. This would imply that an equilibrium would exist around 1,750 outlets. The province's half-baked plan is not a path you want to go down without a contingency plan, in my opinion, in case 12% is not enough to secure the current provincial party's victory. If storefronts sold guns and weapons, people would be imprisoned without bail, with very strict conditions. Cannabis distributors are given a court date, and operators open again the next day. I assure you that if the laws were enforceable around cannabis, dispensaries would not exist. There can be no enforcement strategies when the CDSA and CC which solely govern cannabis, are compromised and marginalized. This is partly as a result of hundreds and hundreds of charges being filed due to the City of Toronto's enforcement actions, and hundreds of charges being dismissed or withdrawn by the Crown. This has further set precedent to an already arbitrary, inconsistent, and discriminatory cannabis law, which has now rendered all and any enforcement strategies moot, in my opinion. Your fourth line item on your agenda today around the sale of illegal cannabis is troubling. There are no illegal sales of cannabis. This is where the problem starts and dialogue cannot occur. Council actually thinks Canadians operating under the protections of the Supreme Court, the Charter, and the Constitution are criminals. This flawed, myopic perspective prevents engagement and continues the pointless exercise of trying to police current legal cannabis distributors. The province cannot enhance the city's enforcement authority because cannabis is a federally defined Class II substance outside of the provincial jurisdiction. These are the Attorney General's own words at his own press conference. Is Council aware of an interlocutory injunction hearing pursued by the City of Toronto on September 25th, next week? The City of Toronto will lose its challenge in Superior Court and set a binding precedent across the country. The exploitation of Municipal Code 440 will be shown to be an abuse of power, where criminal law power was used under the guise of bylaw enforcement, and the city will find itself in an unfortunate predicament of being served with multi-million-dollar civil lawsuits for the public harm, public safety violations, damages, and destruction against cannabis distributors. The City of Toronto will be rendered moot in its attempts to obtain closure orders, and even more so, probably prohibited from the closure of cannabis storefronts. This is literally a week away. I believe none of you are aware of this.
Thank you. Any questions to the Deputant? Vice Chair Kaichanis.
Thank you, Chair. Through you to the Deputant, thank you very much for coming in. Question that I have is, we heard just a bit of the lounges that exist. Do you think that they should continue to exist, and are they helpful?
I believe lounges should be allowed to continue to exist. I believe they are helpful. I believe it is a great transition piece of infrastructure while we move through the end of Prohibition, so people just aren't wandering around doing their thing in public, being stigmatized. It's a nice place, for a comfortable place for persons to go. I think, as Jodie mentioned, who are all where they can find people who are like-minded.
Have you or any of your colleagues that you know of been asked to participate in any roundtables with the province?
I got a great story about that one. So I was able to infiltrate the Secretariat's office, and that was through
Federally or provincially?
Provincially. And that was through an introduction to a local residents association. There was a lawyer there from Faskins, Norm Keith, who picked up the microphone and found it quite troubling that the LCBO had hired Deloitte to lobby the Secretariat to, of course, create the CCBO. And there in our midst, lots of pictures and photos, was Deloitte administering the tabulation of the results around the discussion tables. So a severe conflict of interest. Save and accept that roundtable discussion, no one has ever tried to approach any of us.
So here we got the province that putting regulations forward, absolutely no discussion, absolutely no stakeholders meetings, absolutely knee-jerk reaction in order to probably satisfy some of the electorate that comes around the corner.
Yes, unfortunately, the cannabis industry is being guided by a little bit of an unnatural force. I don't know how the construction of licensed producer public companies came to exist, but when you have a company like Canopy Growth worth $1.7 billion, I can assure you it's not in the business of selling cannabis, it is in the business of selling stock.
The other question that I have for you is, had we as a city approached you when we had the opportunity to hear from you a couple of months back, do you think that we would have listened and probably spoken to the province in a different tone?
I'm here today to convince you of not going down line item 1 at the top of your report to endorse the province's plan. I believe had we had the opportunity to come before you, for you to see the how everybody's actually embraced public safety, addiction services, child safety, harm reduction programs within this industry, self-governed while under attack, I believe you would not be going down the current path you are.
Endorsing the province's report, how hurtful would it be to the people that are suffering and need cannabis in order to survive on a daily basis? PTSD sufferers, people that are suffering from chronic pain, people that are suffering from cancer. How would we do an injustice to them?
The province is going to be unable to build a dozen, let alone 40 stores by July. I believe that will produce significant public harm and restrict access. I believe it'll do the opposite of what's intended. You're going to have a proverbial gas plant that you're going to have to dismantle that's half built.
So the people that are the frontline EMS, fire, police that are suffering from that, as well as a lot of our veterans, we're doing a disservice to them.
I believe you are, yes.
So we stand up and we thank them for their service and we sing their praises, but right now we're about to fail them, correct?
In my opinion, yes.
Thank you, sir.
Thank you.
Thank you.
Ben Respin.
Hi there.
Please go.
How do you do? Is that on?
Please go again.
Check, check, check. All right. Hi, guys. I'm Ben. I'm here as an ally to this community. I'm a big fan of what most of these people do. I come from the music industry. Been doing it for about 30 years. Been nominated for Junos, all sorts of stuff. I've had a great time, got to see the world because of music. I kind of got involved with some of the people here. I know a few of the people in the room because my company was tasked to start producing fundraisers for MMJ Canada. Through that, I've gone around the country and kind of met a bunch of the people in this industry. Now, I'm going to say this. I was going to go into a few other things, but it'd be a bit redundant right now. You don't for 30 years, and I know it seems kind of crazy. I look so young and beautiful, but I did, in fact, grow up in rock and roll clubs for the past 30 years, okay? And so you don't live in rock and roll clubs, since you're an early teenager and not meet like a shady element of people. I've met them all. It's not these people. These aren't the people that come. The black market don't come and ask to work with you. This plan, the only people I know that are celebrating this plan are people who support the CCBO and the people I know in the black market. And those people are bad dudes, man. That's bad dudes are excited about this plan, not these people who are asking to work with you. And that's really all I have to say about the subject. That's the truth. And you guys have to it's up to you guys to help out all the people in your city, right? That's you. This doesn't help those people out at all. I swear to you. I swear to you. I know who's celebrating that plan. That's all I got to say. Thank you very much for your time.
Thank you. Questions?
I don't get in this environment too often.
Thank you for your presentation. There is no
problem.
Questions
No questions?
No questions.
Okay.
I almost want to ask a question.
Well, when do we call him back?
Adam Cherny.
Call back. Just kidding.
The next deputant is Adam Cherny, followed by Melissa Ralston.
All those names out again, Chair.
Adam Cherny,
Melissa?
followed by Melissa Ralston. Please go ahead. Good to have you here. 5 minutes, please.
Okay. My name is Melissa Ralston, and although I've been heavily involved in this industry for roughly 8 years now, I'm actually here to represent my generation, which are the future leaders of this country. I wanted to speak on item 1 in regards to how by endorsing this new provincial regime will actually potentially shrink the market. So if you're looking at a pie that is roughly $6 billion, by having it only endorsed by the provincial government could potentially decrease that by 50%, which is removing innovation from this industry and removing possibilities for future leaders and entrepreneurs to try to enhance and advance our country. I would also like to speak on item 6 in regards to the private residences. This actually is perpetuating a stigma, and it is taking away the opportunity for medical patients to be involved in a community and for them to be surrounded by people who are praising their advancements through their treatment regimes. Lounges create a sense of community, which is incredibly important in this industry. I personally have worked in a chronic pain clinic since 2009 and left roughly 4 years ago, where I was involved in the industry on both a legal side as well as a quote-unquote gray market side. When I was at the chronic pain clinic, our only option was to send patients to dispensaries. It was the only safe point of access for them, and now the provincial government is planning to implement a new regime that is, in my personal opinion, going backwards. And I would like to end my comments on item 4. Mark Pagash, the Toronto police spokesperson, said that the city doesn't have the resources to close all the city's dispensaries. So I want to leave you, the committee, with this question. Where does the city plan to get the funding? And are you aware that the LCBO is planning on providing hundreds of millions of dollars in order to shut these dispensaries down?
That it? Questions? Vice Chair Karijanis.
Thank you. Thank you, Chair, and thank you to the presenter for coming to speak to us today, the Deputant. Are you aware, I haven't been able to follow up, but what happened with those buses? Was it Carla or Operation?
Project Claudia was one of the first.
What happened with that? How many of them were thrown out?
I don't know the exact number offhand, and unfortunately it's not in my notes, but what I do know is that Chief Saunders did make a statement that said that the reason why they wanted to roll out Project Claudia was because they didn't want people from Vancouver coming into the city and taking over the market. When I was at the chronic pain clinic, there was about 4 to 5 dispensaries that quietly existed that had been involved in raids but were allowed to stay open so that patients had a place to go and have access to their medicine.
Wasn't that about the same time that, I can't remember, but maybe you can correct me, or the same time that the city sort of, through the mayor's office, got a couple of emails, and the mayor started speaking that, we got to crack down on this, and was that the same time?
Correct.
Would you say that was a knee-jerk reaction on behalf of us listening to the mayor?
Correct.
Thank you.
We have completed the list, but we have 3 additional speakers that were added on later, and that's Peter Francis, followed by Alex Newman and Tonia Saloom. 3 more. Good afternoon. Good to have you here.
Hi, my name is Peta. I work at Vapor Central. It's a vapor lounge. I just wanted to speak on behalf of the community and those who will be affected by closing cannabis lounges out completely. One of the things I did want to start with, I wanted to know, have any of you guys been to a cannabis lounge? By a show of hands? No. Okay, so none of you have been to a cannabis lounge, which is, indicative of the policy that's being put forward. But I want to share my experience from this community because I want to let you know that there's a lot of education and a lot of intelligent people here, as you've already heard from today, who know a lot about marijuana and can educate the public at large. So to shut us out seems pretty irresponsible as a policymaker, because when you consider the proposed policy, I want to know if questions like who's going to be doing the training run through your head. Will it be the LCBO unionized members who have never sold cannabis before, advising people on how to use the products? Because if you come to one of our vapor lounges, you're going to learn how to use cannabis in a responsible way. You're going to learn how to use the equipment, and you're also going to be able to socialize with other people who have past experience who can also educate you. It's a great atmosphere, and essentially when you do come in, all you see is people sitting around watching TV, smoking cannabis and laughing together. I have cards here today. I do invite some of you to take a look at a cannabis lounge. Come in, enjoy. We're very welcoming. We want to see you there, especially if you're going to make policies that hurt our community, especially if you're going to make a policy that will lose jobs for people like me, millennials, who have a hard time finding other jobs in other industries. This is something that we can be heavily employed in, and I'd like to see this committee take that seriously. Some other things I wanted to say was, if you even look at Vapor Central's history, we've been open for like 10 years. You can look at incidences. We don't have any. The only time we've had any sort of problem is if a drunk comes to the door, and we immediately ask them to leave. We have problems from other regulated substances that come to our door, not from cannabis. If you watch outside of our door, we leave people happy and smiling. They're out there, if anything, smoking a cigarette. If you look 2 blocks down, all you see is puke on the sidewalk from people who've come out of bars. So I just want you to consider these things when you try to come and say that marijuana is demonized, because again, as you know, it's medical. And that's pretty much all I have to say for now.
Thank you. Councilor Janis.
Thank you. Thank you very much for coming. I'm going to ask you a different set of questions. Where you work in a cannabis dispensary?
I do not work in a dispensary, I work in a vapor lounge. We don't sell any cannabis products. Essentially, the format is people come with their own cannabis products, and we allow them to use our equipment. So they can use our vaporizers.
Was any of these, your set of businesses, busted on Project Claudia?
No.
Okay. Do you know of anybody that was busted in Project Claudia? Okay, no problem. Thanks.
No, because we don't do anything illegal. Okay. But under this legislation, we would be something that would be illegalized. I know you disagree, Councillor, but come visit. Vaporizing, indoor vaporizing, it's something to consider. Look into it.
Thank you.
Thank you. That's it.
Alex Newman.
Good afternoon.
Good afternoon, sir.
My name is Alexander Newman. I've been in the cannabis business for the past 5 years or so, but I'm coming to you as a former law enforcement and healthcare professional. I've worked for Canada Border Services for 2 years. I have enforced federal laws. I'm probably the only person in this room, perhaps, who's actually arrested somebody directly for cannabis. I'm a licensed social worker in this province. My history of work deals mostly with youth. I've worked with Big Brothers Big Sisters, Children's Aid Society, Victim Services, etc. Broadly speaking, the provincial proposed legislation is not going to accomplish its stated goals of public well-being, youth prevention, eliminating the black market. Obviously, we've heard from a lot of different people. I'd like to speak more specifically on enforcement, because at the end of the day, laws can be written, but if they are unenforceable or if people are not listening to them, they're kind of useless. Specifically, I want to talk about public consumption. What essentially is being proposed is that cannabis is going to be legalized. You can buy it in a store, but you can only smoke it in your private residence. Well, a lot of people cannot do that. And so for a very large segment of this population, we are telling them, here's a product you can now buy from the government, but you cannot actually use it. And then we are supposed to expect the police. I find the idea of Toronto police stopping and ticketing or enforcing people smoking weed on the street just ridiculous. You're now going to have your frontline officers be willing to do this. What, ticketing individuals for what, smoking on the street? Like, I don't believe, as a person who's worked in a federal law enforcement, that frontline officers are even going to be interested in doing this. They're not interested in enforcing cannabis laws now when it's illegal. Why would they do it again when it's not? I mean, we're talking about more tools and shutting down stores, but at the end of the day, you know, public consumption enforcement can be very difficult to do, which is why I suggest that lounges should be licensed. And I feel they're going to solve a lot of the problems that this law is going to create. You know, as it's been said, there hasn't been any issues. I don't think if we never even came here, you would even know we existed. You know, we're not in your backyard. We, you know, creates an element of social responsibility. Ultimately, I feel that it is a problem saver. It will save you money. It will save you potential court challenges, and it'll just make people happy. Any questions?
Thank you. Is there any questions for the deputant? No? No. Thank you. And the last deputant that we have is Tonia Saloom.
Hi, my name is Tonia Saloom. Thank you for giving us the opportunity to speak today. I'm speaking to number 1 on the agenda. Patients are being forgotten during the process of legalization. We feel that the CCBO model doesn't provide the clinical approach that dispensaries offer. In 2016, we had just over 100 dispensaries here in Toronto, and they were all busy and sustainable. Having just 150 dispensaries in Toronto is a big concern when you consider how many patients rely on this medicine to have a better quality of life. And lastly, if we look at Uruguay, we can learn from some of their mistakes. They started with the pharmacy model and it failed. Now recently they've been using the dispensary model, which proves to be effective and is what the citizens wanted. And that's it. Thank you.
Fantastic. Thank you. Short and to the point. Thank you. Any questions? If not, thanks so much. Now we'll go to questions to staff. Members of the committee, any questions to staff? Deputy Mayor Maker to begin with. Please go ahead.
Thank you. Through you, Mr. Chair. I think during the deputations today there was some debate or difference of opinion on what's legal versus illegal. One company said, yeah, we're illegal and we know it. And the next speaker said, no, they're not illegal and I know it. From your perspective, are the dispensaries a legal activity in the City of Toronto or an illegal activity in the City of Toronto?
Through you, Mr. Chair, the only law currently that permits the sale or distribution of marijuana is the medicinal marijuana regulation, the access to cannabis for medical purposes regulation, and it prescribes the manner in which medical cannabis can be procured. It does not permit the operating of storefronts. So, in short, the storefronts that are operating in the city are illegal.
Okay, great. And I think there was somebody else who said to us that we've got the set of recommendations before us, and people pointed to recommendation number 1, that City Council endorse the province's plan for provincially operated retail model. And one deputant, if I understood him correctly, said, well, this might actually cause significant public harm. In your opinion, your name is on this report and you're recommending we endorse the province's approach. Do you believe that there will be significant public harm if we endorse these recommendations and if the province moves forward with its plans as they're currently proposed?
No, I do not. I believe both the intent of the federal government and the provincial government is to ensure that public health and safety and the mitigation or reduction of harm is first and foremost in their intention in the manner in which they are choosing to legislate. And having participated through a number of these sessions, that was a very clear guiding principle from a public policy perspective, that everyone is concerned and wanting to ensure that public health, public safety are paramount. So no, I do not believe that that is the case, nor that is the intention. This is a significant culture change for the country. It needs to be done in a cautious and deliberate manner, because public health and public safety, in particular, the health and safety of our youth, is not something to be entered into lightly.
Okay, that's it, Mr. Chair. Thanks.
Thank you. Vice Chair Kajianis, go ahead.
Thank you. Through you to staff, in looking at LS 21.1, third paragraph down, it says 400 stakeholders through 11 formal consultation sessions. And this was the thing that we dealt with this morning. Can you please let me know how many folks were consulted in coming up with these recommendations? How many stakeholders?
Through you, Mr. Chair, we are governed by the manner in which the legislation is rolled out. We were awaiting the decision or the release of the province's plan on distribution. We have held no public consultations on this issue municipally.
Have we held any municipal consultations? Your recommendations to the province, would that have been different after what you heard here today?
Through you, Mr. Chair, no, sir, they would not.
Can I ask why?
Through you, Mr. Chair, quite simply, the legislation and the regulation governing the consumption of marijuana is a federal matter. They have distributed the legislative responsibility for the distribution to the province, and we are responding to that.
I mean, driving a car or buying a car or having a transportation vehicle, that also is a federal matter. But we go ahead and make recommendations and we make bylaws and we make all kinds of things that we administer. And what is the difference between that one and this? I mean, it's a federal matter, and here you got a federal matter of transportation, but we make the rules and regulations, the bylaws. Why could we not see it through that lens?
Quite simply, through you, Mr. Chair, because operating a motor vehicle is not illegal, and the sale of cannabis for other than medical purposes and being sold in this way is illegal.
We were not sure if it was going to be legal until the province came up and said that this is the way that we're going to sell it.
Through you, Mr. Chair, no, sir, with all due respect, it's very clear. The possession and sale distribution of cannabis has been unlawful for decades. In 2001, the federal government created a carve-out, an exemption for medical consumption purposes and medical consumption purposes only. That is currently the legislative regime we are operating under until such time as Bill C-45, the Cannabis Act, allows for consumption, regulated consumption for non-medicinal purposes. And that is the focus of this report. It is not to address the medical marijuana regime, which will continue. This is to address the non-medicinal or recreational use of cannabis.
You're recommending that we support the province's regulations?
Through you, Mr. Chair, yes, sir, I am.
I mean, after what we heard here today, isn't that enough to sort of say to you that the province has gotten wrong? They have not consulted. They have not reached out.
Through you, Mr. Chair, I'm aware that the province did have open for consultation and comment a survey throughout the summer. It is not for me to gauge if the adequacy of their consultation methods. I do know that my involvement on this file, federally and provincially, everyone that is involved in this has absolutely got the public health and public safety, public policy objectives first and foremost. I think everybody is learning through this process. This is where the province has determined that it wishes to start from a distribution perspective. It is a cautious and deliberate move, and I support it.
We were told that we got it wrong when it comes to first responders. We're told that we got it wrong when it comes to people that are suffering. We were told this by the industry that is here. You did not consult the industry. We did not consult the industry. We waited in order to see what the province was going to do. By us approving what the province says, isn't that giving the province a carte blanche, and they can turn around and say, the City of Toronto approves it, when the majority of the residents and the majority of our Torontonians, people that are here today, did not approve this? They're not. I didn't hear anybody approving us what the province is doing. Why are we giving the province a carte blanche and say, go ahead, we're behind you, when they got it wrong? Why are we also getting into that canal, that mentality that says it's okay, they got it wrong, let's support them?
So through you, Mr. Chair, just for clarity, the distribution model that the province is proposing is for the sale and distribution of recreational use marijuana. The medicinal marijuana federal regulation remains in place. Both of those systems will be running concurrently, and the federal government will be reviewing it as they go forward on how to deal with the two concurrent systems. So no one is taking away, through this particular report, the province's framework on recreational, non-medicinal distribution is not addressing or impacting or impeding the current federal regulation governing the consumption, possession, distribution, and production of medical marijuana.
My last question, if I'm allowed. How many other reports have you written that have absolutely no consultation like this one?
Yes,
Through you, Mr. Speaker, that's a simple question. Mr. Chair, it's a simple question to answer. We absolutely undertake full consultation when we are creating bylaws that fall under the regulations and the regime of the city and city council to determine. At such time as there may be a need for the municipality to be involved in passing bylaws governing this particular topic, then we absolutely will hold the appropriate consultations. At this point, there is not a municipal action to be taken as far as passing any legislation, ergo, no consultation at this point.
Thank you. Well noted. Speaker Nuciana.
Yes, and when you do consultation, you'll be consulting with the residents that live in these communities, correct?
Yes. Through you, Mr. Chair, absolutely.
Yes.
That is a contested.
And that's who should be consulted. Just a few questions. As far as the penalties in recommendation 5, to establish higher maximum penalties. So would it be the province that would be determining the penalties?
Through you, Mr. Chair, it can go a number of ways. They could embed the penalties within their cannabis legislation, not dissimilarly to what they do with the Occupational Health and Safety Act and others. And/or they could authorize us, if there's any regulation that we do need to pass, that we have the opportunity to attract those maximum penalties. But the overarching provincial statute, whether it be their cannabis regulation, City of Toronto Act, whatever act is required to be amended to give effect to a higher penalty, and then we would be involved in that. So they would set the maximum. And then those matters, as they're dealt with through the courts, it's the determination of the Justice of the Peace how any fines are applied.
So we can give input on the penalties?
Certainly, we are seeking a higher penalty range.
Higher, just like we do any other illegal establishments that we've been fighting for years here, right?
That's correct.
Yeah, that we're trying to close down, right?
That's correct.
Now, as far as to issue or obtain closure orders for premises on the same recommendation. So under the City of Toronto Act, we don't have that authority now. We would, similar to when we have to have access to some of these bars and other illegal businesses that we're trying to get access to. We don't have that authority right now. We need the province to give us that authority?
No. Through you, Mr. Chair, we do have the authority in the City of Toronto Act to apply for closure orders. I don't know if our solicitor would like to step in.
Yeah, I'll step in here. The City of Toronto Act does authorize the city to seek closure orders for businesses that aren't in compliance with, Chapter 545, the business licensing regime. This request is to seek the authority for closure orders in a broader sense and prior to conviction. So it is a new request, but to your point, there already is the ability to seek closure orders in some contexts.
And so we do have that, but illegal rooming houses and all these other, we don't have that authority.
So,
right?
Yeah.
You know what I'm talking about, Tracy,
I do.
right? Yeah.
So again, to the nuanced point there of rooming houses, that might be a slightly different response. However, with respect to unlicensed businesses or non-compliant businesses, there is that authority to seek closure orders. We'll also note under the City of Toronto Act, upon conviction, there are the abilities to seek prohibition orders from a justice as well. Those can operate in very similar fashions, although not directly against the property.
Okay, because these are some of the issues I've been fighting for years. So, on recommendation 8, this would be my last question, to regulate the location of production facilities through zoning. So explain that. Explain that to me, that recommendation.
Yeah, through you, Mr. Chair. In 2013, when the federal government released the medical marijuana for purposes regulation, we at the same time enacted a zoning definition through our planning growth management, our partners in city planning, to allow for medical marijuana production facilities. So those do exist. So that was the regime that was put in place for medicinal marijuana access in 2013. So this recommendation is simply to continue, that we would continue to regulate where those establishments are.
Okay, thank you.
Any other questions? Councillor Giorgio, please go ahead.
So with respect to our enforcing or closing some of these illegal dispensaries, presumably, how successful have we been in the past? Do we have the
Yes. Through you, Mr. Chair, we have been consistently and continuously inspecting and laying charges. Our current count of operating dispensaries that we're aware of in the city is 62. When this started, actually it started February 4th of 2016, when I initiated this partnership with the Toronto Police Service to address the proliferation of the illegal storefronts, it was climbing north to 100.
Okay.
So we have been, now it is open and close and open. So it's an ongoing issue that we are continuing to address.
And given that it's an ongoing issue, have we approached the province to provide us with some additional resources to enable to perhaps improve?
So through you, Mr. Chair, that is one of the recommendations here, Councillor DeGiorgio, that the province does play more of a deliberate role going forward, because this is, as I note, in 2016 is when this really started becoming an issue in our communities. Now, as we go forward, that partnership with the province will be important as well.
Okay, and my last question, you talked about open and close, open and close. Have there been, let's say, a group that just remain open?
Yes, there have. Through you, Mr. Chair, yes, we have a steady cadre of people who are continuing to be willfully non-compliant. And one gentleman spoke, we are in Superior Court next week seeking an injunction against one of those operators.
All right, thank you.
Any other questions? If not, I do have a few. On page 14 and 15, city staff needs detailed direction from the province on home cultivation. Now, on that, do you have any concerns as it relates to home growing, given safety concerns that may relate to electrical fireplaces, moisture, odors, and so on within many apartment buildings and so on? Do you have any concerns?
So to you, Mr. Chair, the regulation, if people operate in compliance with the law, the federal law allowing up to 4 plants, we're not concerned from a the grow-up stories that we've heard of the past. It's where we have larger scale production happening in residential properties that would constitute a commercial production facility, and we have been involved in some of those cases, then absolutely, and my partners from Toronto Fire are here, and I'm sure where someone decides to operate a full-scale commercial facility without the proper electrical, et cetera, we would have concerns. But in the context of what is proposed to be permitted for home cultivation, and the home cultivation, a personal grow or a designated grower came back into place for medicinal in 2013, or 2016, sorry, and the recreational is purporting that. If it was kept to those minimums, it's less of a concern, but still the appropriate measures need to be in place, which is why in one of our recommendations we've requested on places of consumption and on home cultivation where the regulations are unclear, that we want to ensure that we're at the table having the conversation with the province on what those two pieces of this regime will look like.
In terms of enforcement, if this was to happen, in terms of enforcement, do you have the resources to inspect? If there is any inspections, will that be on complaint basis or in a proactive basis?
In respect to home cultivation, so through you, Mr. Chair, and it's also one of the reasons why there's no numbers articulated here. We don't know what the municipal impacts may be, so we're going to have to determine that as we go. And depending on the type of regulation that is passed by the province, and then there may or may not be necessary regulation municipally. We don't know that yet. That will certainly inform what we would project impact to resourcing would be. So we just don't know right now.
So there will be further discussions on that.
Yes, sir.
Now, in terms of clarity, once again, with Bill C-45, as it relates to the production and distribution of medical cannabis, that will continue to be the way it is. The new legislation will allow the medical marijuana to be distributed the way it is.
So to you, Mr. Chair, the federal government is keeping in place the access to cannabis for medical purposes regulation, which is the regulation governing medicinal marijuana, which has been in place since 2016. Its predecessor was the MMPR in 2013. It was the MMAR in 2001. So through those various 3 regulations governing medicinal marijuana, the current is the ACMPR, and it is going to continue to be in place insofar as it dictates production, distribution, et cetera. And that's my comment earlier, is that regulation, which is currently in place and has been for a number of years, has not permitted the storefront distribution sale. It prescribes how people are to obtain medicinal marijuana. C-45, the Cannabis Act, is to deal with the non-medicinal.
So on the explosion of non-medical medical marijuana shops, as we had in the past, the position that the city took, it was more on a proactive way, or it was through complaints from local communities?
Through you, Mr. Chair, both. But a predominant amount has been proactive. We have had a number of complaints from different communities, particularly when a illegal storefront exploded in August of last year on Eglinton near Yonge.
Yes.
Certainly, I can share with you the number of complaints and types of complaints we get from communities that are concerned about the existence of some of these storefronts. And that's just not to disparage anybody who may be well-intended in this room, but unfortunately, it's not always well-intended, and the fact is the law does not permit this type of operation. And communities are concerned, people are confused, and it's important that everybody understands what the rules are and abides by them.
Great, thank you. Now to speeches, motions. Okay, so we'll start with the Deputy Mayor, Libermaker. You have 5 minutes, please go ahead.
Thank you, Madam. Sorry, I'm used to Councillor Anziatis being in the chair.
Any motions to be moved?
Yeah, no motion. I'm just going to move the staff recommendations. I don't even think I have to do that, but just in case, because they're before us. I'm going to move the staff recommendations. I'm going to maybe step back and say, certainly I welcome the federal and provincial legislation. There are people here talking about trying to legalize marijuana. I think legalizing marijuana is a very, very good idea. Should have happened a very, very long time ago. So I'm very happy that we're legalizing this product. So to those advocates and people who have fought those many, many battles and maybe faced some hardships, my hat's off to you. I congratulate you. This is a good thing that the nation is finally doing. What's before us is a comment on a provincial plan. We don't make the decision about who sells marijuana. So I appreciate the input. I've been educated by a lot of very intelligent, smart, and dedicated people, but you're talking to the wrong guy. I can't, even if I wanted to, say, hey, open up a dispensary over there or open up an LCBO over there. I can't do it. The mayor can't do it. The chair can't do it. None of my colleagues here can do it. It's not within our legal jurisdiction. It's the provincial and federal governments that have jurisdiction over this. When you look at our recommendation, we may have some minor role in talking about how close this store can be to that store, but the decision has been made by the provincial government adopting a model like the LCBO. I personally, again, I do not smoke marijuana. I do not smoke cigarettes. I do not drink alcohol. None of the above for my entire life. Not even in Scarborough as a high school student, not one bottle of beer, not one joint, not one cigarette. But being, yeah.
Isn't that what Clinton said?
Fortunately, I ride my bike about 40K a day, so that helps me loosen up and relax. Probably a healthier way to loosen up and relax than some other methods. Mr. Chair, the LCBO model for alcohol, I think, has worked quite well. I really, in my adult life, I don't hear many of my friends saying at parties where there is alcohol, the LCBO, it's just horrible. It's just horrible. I can't get any product there.
Please.
Sorry, I don't think I interrupted you when you were up at the mic, sir. And your friend, yeah, I know, your friends were. So, I didn't interrupt you. I would ask you to give me the same courtesy as I gave everybody here. Did you hear me interrupt anyone while they were at the mic? So please, be respectful, or be respectful.
Okay, security, okay? Please be alert.
So,
I'm sorry,
so Mr. Chair.
Yes, I'll give you an additional 30 seconds there for the interruption.
Yeah, so Mr. Chair, the LCBO model has worked. Now that they're talking about distributing marijuana, I think it'll work too. In fact, thanks to the magic of my cell phone, I went online. The LCBO sells 23,000 different products. I'd imagine most people who smoke marijuana, when they go into their LCBO dispensary, will find out that, wow, 23,000 different marijuana products from all around the world? You're going to think you've died and gone to heaven. So I think The LCBOs, with their ability of bulk purchases, their ability to have wonderful staff that are informed and charming, are actually going to serve people's needs very well in the recreational field. So I'm very comfortable moving forward with the LCBO model. I'm not worried about people saying, well, you know, it's going to be inaccessible, or the people there aren't going to be very good. I've had people say, well, I'm an employee, you're going to put me out of work. No, actually go to the LCBO, get a job there. They, they're unionized. They pay very good wages. The young woman might actually make more money in a year or two from now than she does now, because she may be working in an LCBO store that is unionized, that has regulations and safety measures put in that are probably higher than many people in the private sector. Again, my experience as somebody who doesn't drink, when I walk into the LCBO store at my Cedar Brae Mall, they're all over me like flies to honey. I can't take 10 steps in there, and I don't know what to buy. I've never drunk in my life. But you know what? They give me 15, 16, 17, 18 different options. And I think that's what's going to happen when you all walk into the LCBO store to buy your marijuana, or your CCBO store to buy your marijuana. There'll be a nice, charming person, just like the one who came forward to us and talked to us today, who will say, you can try this, 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 and this one goes good with steaks, and this one goes good with Twinkies. So I'd support the recommendations. I think it's a very good move forward. Thank you.
Thank you. Vice Chair Carichanis.
Thank you, Chair. I do have a motion that I would like the staff to put up, please. The motion is that we receive the item for information. Hardly any consultations were done with the stakeholders. It's very unusual that we read reports and the reports do not come out 7 days before, as it was. This came out a little bit later than usual. It's very unusual that you do have the executive director's name on a report. Usually it's a staff person. I don't believe that we've done a good job on this. I think we failed. I think we stifled democracy. I think the people that were here today certainly do not agree with that. We stifled them twice before, and today we sort of like listened to them, and I think it's just to pacify them. The province has got its own agenda, and the province will go ahead and do what it wants to do. And for us to be part and parcel of what the province and say to the province, not a problem, you're doing things well, I think this is a mistake. Many a times the province has done mistakes. Many of times we disagreed, and many of times we rise and we tell the province that, hey, what you're doing is wrong, although we have no hope in hell for them listening. But to endorse them, to endorse their mistake, is certainly something that they will stand up and say, the City of Toronto, the 1/3 of our population endorses us. Well, nobody here today, and all the people that were able to be here today, be it residents, be it stakeholders in this industry, this was an open meeting. They had an opportunity to come. Nobody here today gave us the sense of what the province was doing was correct. The only thing that we heard time and time and time and time again is this is a big mistake. So therefore, the province is going to do what they want to do, but for us to be part and parcel of their mistake, for us to endorse what they're about to do, for us to endorse their by-election in a couple of months down the line, that is truly wrong. For us to endorse where they're going is certainly wrong. We're not guaranteed that the province where these cannabis stores that they have will be opening up will be with a certain distance from educational centers. We're not guaranteed that it's not going to be in the same mall that you might have a dance school or a Kumon. We're not guaranteed at all. We have the opportunity to say, look, we want them to be so far away from educational institutions. We have the opportunity to also put down how we want it for them to function. But the only thing we're going to do, we're going to bend over, and the province is going to tell us where they want to do it, how they want to do it, and it's Big Brother telling us in the city how we must do it. None of the stakeholders that are here was actually consulted by the province. One of them said that they sort of went in through the back door and listened to what they had to say. The province has failed. This is an injustice to the people that are actually either marijuana, occasional smokers, recreational, or people that are suffering. The people that are suffering, you have to put yourself in their shoes. You might want to slough them off and say it doesn't really matter. Put yourself in the shoes of a veteran that is suffering PTSD, and that individual served this country overseas, and he or she comes back and is in a woodshed because they cannot face their demons. And they have to go in order to get the cannabis to smoke. If you haven't, I encourage you to reach out to the veteran community. I encourage you to reach to our community, our first responders that are suffering. They're suffering from PTSD. It is not easy to go to a trauma scene. It is not easy to walk in somewhere as a paramedic or a firefighter when you see somebody's brains being blown. You're suffering. And the only recourse you got is this. And for us not to make this available to them readily, I think this is an injustice. It is a mistake. And we're certainly going to hear for this during the provincial election, and there will be a price to pay. Let us not be party to this mistake. Let us not make the mistake that the provincial government wants us to do. I know what the black market does. My area was infested with marijuana grow houses back in 2003, 2004, 2005. Here's an opportunity to legalize it. Here's an opportunity to make it readily available to people. What are we doing? What are we doing? Giving the province the carte blanche is a mistake. So therefore, I move this. Thank you.
Thank you. I'm going to make a ruling on the Vice Chair Carigiani's motion is out of order. At this level, we think that this committee doesn't have the jurisdiction to do it. Either it can be deferred, it can be referred, or sent to City Council without recommendation. That's the only thing, the only authority that this committee has. So your motion is out of order.
Chair, can I ask a procedural question?
You spoke already. Thank you. That's my ruling. That's my ruling. You can challenge me on that.
I'll challenge on it.
Is the chair has been challenged? Don't have the chair. All those in favor?
Well, Mr. Chair,
holding the chair.
I didn't hear your ruling. You said we can blank, blank, or blank. I just want to understand. I thought we could receive information. I thought we could receive information. You're saying we cannot.
No.
We've done it in the past.
The recommendations from city staff can be deferred, or sent to City Council without a recommendation. That's as much as in terms of any delegated authorities from this committee.
Am I allowed to change it?
Given that he's been notified that it's out of order, he should have the opportunity to amend it slightly to make it in order.
The chair has been challenged.
You have to rule. Through the chair, the committee has to rule on the ruling.
Oh, so, and if it's ruled out of order, then he could amend it to make it in order.
Correct.
Okay.
So, all those in favor of upholding the chair? Against? It's a hand.
Do I have an opportunity now to modify this? I believe that staff took it to the lawyer, and the lawyer said it was appropriate. That's why they typed it out.
Yeah, I think his intent was
to... Would I be incorrect in that?
I think that, Councillor, is you can do that at City Council. There is another opportunity at City Council to speak up. Now, I'm going to speak on this.
Sorry, Mr. Chair,
hold on
on the point of
hold
order.
On a second, Chair. Hold on. You're going too fast here. Just hold on.
I think
not stifle democracy.
Yeah, can I just? I think Councillor Karagiannis' intent was perhaps to refer back to staff for further consultation with stakeholders. That would have been in order, but he worded it, I'll say, incorrectly. You've educated him that and informed him that that wording is out of order. I would think, as a courtesy, we would let him put a motion forward that is in order, and we can vote on it. We may or may not support it, but certainly his right to put a motion forward should be permitted.
If there is another speaker who is willing to do that, by all means.
Okay.
Procedurally speaking, we have gone through the steps, and you know, Deputy Mayor, how we work that. To speak, any other speaker? Okay, Councilor Sierra.
Okay, thank you. And I, as well as I support the staff recommendations, and I disagree with the previous speaker that we're giving carte blanche. You know, what we're doing is okay, Councillor Karagianis, please. When I was there talking to staff, you told me not to speak, so I'm telling you not to speak now. Please.
Come on.
You cut me off when I was there, so. And I'm also asking the public to behave themselves.
Please.
I will be supporting the staff recommendation. We're responding to the province, and what we're doing is we're putting forward recommendations on to the province that this is what the City of Toronto is requesting. Because at the end of the day, we want to make sure that we get what we deserve to get. And as far as enforcement, I think we should have higher penalties. I agree with that, to give the authority to the city, and also to ask the province to fund us financially as far as the enforcement end of it. We should be asking for all this. If we don't, then the province would just be passing it and not listening to what the city's requests are. We've done that many, many times. I mean, we as well, when we're dealing with the payday loan issues, right? We had to go to the province and plead with them to give us the authority, and you know, so we need to make these requests. And you know, okay, I support...
To the public, once again, you've been so good so far, let's maintain that level of civility in the quorum. Councilor Musiera, continue.
And like I said, and some of these requests I think should be a little tighter too. When we asked the questions to some of the deputants today, that they realize that they're operating illegally, yes, they acknowledge that, but they still continue to operate illegally. We as politicians, what do we do when we get complaints from constituents, which I do all the time, about illegal businesses that are running in the area? Why aren't we closing them down? Why aren't we enforcing the bylaw? On and on and on. What makes this any different than any other illegal business that we're dealing with as politicians? It's our responsibility to uphold the law and to make sure that businesses run legally in the city, and if they're not, we need to enforce it, and they need to be penalized. I've had a number of establishments open up my ward. Immediately, I've reported them, and they've been closed down, and they're just popping up like crazy. And residents are complaining about it. They're yelling and screaming. And if we're going to do any consultation, we do it with the residents that are living next to these establishments. That's what our obligation is. So I do support these recommendations, and we'll have to see. As far as the province, the province makes the final decision, but we need to protect ourselves as well, because we have an obligation to our community to ensure that we're able to function, and we're able to regulate, and we're able to enforce the laws that we have, and also be financially reimbursed for any of the costs, because there is going to be a cost as far as policing, staffing, and other enforcement. So thank you to the staff for working on this report, and they've been working on this report for a while now, so you've responded to it, and thank you to that.
Thank you, Councilor Sierra. Councilor Di Giorgio, you're next.
Thank you, Mr. Chairman. Well, I think what I heard the executive director say was that the province has legalized recreational use of cannabis. and they're asking us to proceed rather cautiously, that the only distribution outlets will be those outlets that are licensed through this subsidiary company of LCBO. I suspect it'll be an election issue for them. I think once something is legalized, we as a city, under the City of Toronto Act, do have the licensing powers to license people. But I think the province is saying, I guess indirectly, no to us at this point. They're saying the only distribution outlets will be those that we indicate. And I think we obligated Councillor Karygiannis to go the route that is being proposed here, and that is to go to proceed slowly. I suspect if we get more and more outlets that are operating illegally and we can't keep up with the enforcement, we're going to deal with an issue further down the road. And the province may, in fact, allow us to use some of our licensing powers to regulate, because that really is the ultimate, probably, solution to this thing, is that we need to regulate very carefully licensing, and not only that, but where we allow them to locate through our zoning bylaws. And I think that addresses Councillor Nunziata's point as to having consultation with people when they have to go through rezonings and what have you. Anyway, that aside, I support the recommendations that are put forward through Councillor De Beermaker's motion. I think we need to proceed very, very cautiously. Thank you.
Thank you. I'll be brief. I'm going to make some comments here. First and foremost, I want to thank city staff for all the work that has been done and the recommendations that are before us. I want to thank all the deputants. I know how passionate you are, and a number of your concerns. We do share those concerns as well, and we'll continue to pay close attention to it as we move forward. Now, the city, as you know, and we all know, has a responsibility to ensure that this emerging industry operates in a responsible way without, hopefully, any negative impacts on the health and safety of our residents and neighborhoods as a whole, including the industry. Let me share with you something that happened in my own world. There were a number of the proliferation of dispensaries that was taking place. It was getting out of hand at one point, and one of them caught a fire, and we had multiple dwelling units in that building. And it was sad to have a number of people losing their homes there. They couldn't stay there. So I do have some concerns, and those are valid concerns for all of us when it comes to Bill 45, C-45, as it relates to the home-growing operations. We may have to look at the safety issues, especially when it comes to multi-dwelling units and so forth. So I believe that Toronto has a responsibility to offer leadership on this issue. And creating a common sense framework that will allow either public or private dispensaries that can operate in a safe way, in a responsible manner, and that would be the interest of the city overall. So with regards to the motion from my dear colleague, Councillor Karygiannis, doing nothing at this point, I think that's not the answer. As we all know, the city is a creature of the province, and therefore, if they are imposing on us, we may have also to express some concerns, and I'm sure that we are going to have a healthy debate at City Council, and some of your thoughts, most likely, will be implemented as well. So on that note, once again, thank you to you all, and thank you to our city staff. And we have the recommendations within the report that was moved by the Deputy Mayor. So that's before us. All those in favor of the recommendations? Against?
Recorded vote, Chair. Do we have a recorded vote, please?
Is recorded vote that has been Councilors Nuciara, Di Giorgio, Palacio, and Rivera Maker in favor, against Carigianis. Thank you. Thank you all.
Thank you so much. Put it this way, election is coming, they'll pay the price.